Okay, members, we move now to consideration stage of the Sign Language Bill. I call the Minister for Communities, Mr Gordon Lyons, to move the bill.
Mr Deputy Speaker, I beg to move that the consideration stage of the Sign Language Bill be agreed.
Minister, thank you. Members, you will have a copy of the Marshall list of amendments detailing the order for consideration. The amendments have been grouped for debate in the provisional grouping of amendments selected list. There are two groups of amendments, and we will debate the amendments in each group in turn. The first debate will be on amendments 1 to 5 and number 22, which deal with the provision of sign language classes and the definition of the deaf community. The second debate will be on amendments number 6 to 21, which deal with consultation, the conferral of functions on other bodies or persons, the Department's reporting duties and assembly control of regulations. I remind members intending to speak that during the debates on the two groups of amendments, they should address all of the amendments in each group on which they wish to comment. Once the debate on each group is completed, any further amendments in the group will be moved formally as we go through the bill, and the question on each will be put without further debate. The questions on stand part will be taken at the appropriate points in the bill. If that is clear, we shall proceed. So, Clause 1, stand part. No amendments have been tabled to Clause 1. The question is that Clause 1 stand part of the bill. All those in favour say aye. Aye. Contrary of any no. The ayes have it. The ayes have it. Group 1 amendments, sign language classes and definition of deaf community. We now come to the first group of amendments for debate. With Amendment 1, it will be convenient to debate Amendments 2 to 5 and 22. Members may wish to note that Amendment 2 is a paving amendment for Amendment 3 and Amendment 5 is consequential to Amendment 4. I call the Minister for Communities to move Amendment 1 and to address the other amendments in this group. Minister.
Thank you, Mr Deputy Speaker. I beg to move. The amendments I have tabled to Clause 2 do not alter the intention of the bill, rather they refine it and strengthen it. Clause 2 places a statutory duty on my department to actively promote BSL, ISL and deaf culture across Northern Ireland. This includes ensuring access to sign language classes for deaf children, young people and their families or carers. This clause transforms recognition of the languages into practical action. It ensures increased visibility, awareness and understanding of BSL and ISL, not just within public life, but also in wider society, working in partnership with the deaf community. This is where meaningful change begins. A priority of this bill is ensuring early access to sign language, which is vital for communication development, educational progress and family relationships. Making early access a departmental responsibility removes barriers and ensures consistent, equitable support for families. The amendments follow constructive engagement with the committee, deaf organisations delivering classes and legal refinement by the Office of Legislative Counsel. They guarantee that classes will be free of charge now and for future generations. The age threshold will rise to include young persons up to 25 years of age, reflecting developmental, educational and transitional needs. The Queen's University of Belfast report on free sign language classes for deaf children and families, commissioned by my department, demonstrates that early sign language exposure improves communication, social development, educational attainment and emotional well-being. Families learning together and being able to do so without financial barriers create the strongest foundation for children's confidence and development. Free access prevents inequality by ensuring support does not depend on a family's ability to pay. Economic analysis by the British Deaf Association found that early acquisition of sign language is an investment in children and young people and for the public purse. Every £1 invested in early British Sign Language provision yields up to £14 in lifetime benefits, boosting education, employment and health outcomes for deaf children in society. This demonstrates that early year sign language support produces long-term personal, social and economic gains. And this is for British Sign Language as well as Irish Sign Language. Amendment 2 is consequential to Amendment number 3. Following the committee's request that my department consider amending the age threshold for family classes from those under 19 years of age to up to 25 years of age, my officials engaged with the National Deaf Children's Society. They strongly support raising the age threshold to those under 25, noting that language and communication development for deaf young people continues into their early 20s. Families remain central to communication support even as young people transition toward independence. The period from 19 to 25 years of age include major transitions, further and higher education, training and employment, all of which create new communication pressures. Many statutory frameworks already recognise extended needs beyond age 18. Examples include the Northern Ireland Commissioner for Children and Young People Act, support under the Children's Order for Education and Training up to the age of 24, and in England, the Children and Families Act 2014 provides special educational needs and disability support up to the age of 25. The NDCS therefore regards raising the threshold as consistent, fair and aligned with modern developmental pathways. Their own services extend to age 25 for precisely these reasons. These amendments ensure that families will never face financial barriers when seeking essential sign language support. Deaf children and young people up to age 25 can access classes that directly support communication development, educational participation and healthier family relationships. Provision aligns with best practice across comparable children's services. The bill delivers practical, meaningful support to those who rely on early and ongoing access to signed communication. For these reasons, I tabled amendments to Clause 2 that insert free of charge into the duty to provide sign language classes, replace references to deaf children under 19 with young persons who are deaf under 25 years of age. These changes strengthen the bill, reflecting evidence from Queen's University Belfast, deaf organisations, Action Deaf Youth, British Deaf Association and the National Deaf Children's Society. They ensure that families and young people receive the support they need during the most critical developmental years. And they ensure the bill keeps pace with the real needs of deaf children, young people and their families. I come now to amendment number 4, which will be moved by Kelly Armstrong. Clause 2 places a statutory duty on my department to actively promote BSL, ISL and deaf culture across Northern Ireland. As I have made clear, a key element of this is ensuring access to sign language classes for deaf children, young people and their families' carers, especially during those crucial developmental years. I have therefore sought to embed this principle within primary legislation and secured executive approval for this provision in the bill I introduced in February 2025. I do not oppose support for adults who become deaf. On the contrary, as I will explain. However, this bill is about sign language promotion, not broader disability policy. The issue of providing classes for those aged 25 and above who become deaf was raised during committee scrutiny. My officials advised committee that primary legislation is not required to offer these classes. My department already provides accredited BSL, ISL qualifications across Northern Ireland, taster sessions across schools and the voluntary and community sector, and classes for children of deaf adults. All of this without primary legislation. My officials' engagement with deaf sector organisations and health and social care sensory support indicates very low demand for classes for deafened adults. They are advised that many adults who become deaf already rely on a first language and do not wish to adopt a new language. Therefore, there is demand for modern assistive technologies, hearing aids, implants, captioning, speech to text, to meet many communication needs. Practical adjustments like lip reading or clear speech are often preferred to learning a full new language. Many deafened adults do not identify with the signing community. However, where there is a wish to explore sign language by some deafened adults, they may attend classes in further educational colleges. I'll give away to the member.
The Minister for giving way and thank you for your indulgence in this. Very interested in the topic and I've been liaising with my party colleague Andy Allen on this. But we very much welcome the bill. We welcome the changes that are being adopted. But it occurs to me that the success of this bill actually will change how we communicate right across the East and Northern Ireland, and that for those people who develop deafness, that provision might be better on the face of a bill, because in 20 or 25 years, the whole tapestry is going to change quite drastically, and it might be beneficial to put it on the face of the bill at this stage, so that we're kind of future-proofing the anticipated changes that are going to be brought about.
I don't necessarily believe that those changes will come about, because I believe that those that currently find themselves in that situation of becoming deaf later in life already have English or another language as their first language. And as I've just said, the demand is very low, because where the demand exists is for modern assistive technologies. And look, I recognise the member is shaking her head, but that's all of the evidence that we have. That's what we've been told. I know she has a different viewpoint on this. I know that her experience is one that she will speak to. But this is coming from engagement directly with deaf sector organisations. This is coming directly from the health and social care sensory support, who have told us all that there is very low demand, and that what people want to see investment in is hearing aids, implants, captioning and speech to text. We often talk in this place about the importance of co-design. We often talk about listening to the experts. That's what I'm following in this instance. I'm happy to give way to Mr. Donnelly if he wants.
Thank you. I heard a bit of shock there just with the previous issue when we were talking about minimum unit pricing, and there was a disregard to the evidence. So I was just shocked to hear that.
We're digressing, but I can assure the member that's an issue I have looked at, and I have looked at evidence, and I would suggest that it's maybe not as clear-cut as he thinks. Regardless, on this, what we have in front of us, I'm saying I'm going by what the experts have told us. The member has a different view. She will be able to explain that, but both in terms of it being different in regards to deafness that is acquired late in life compared to something that is there for children. There is a difference there. And secondly, going on what people actually want. Now, I concede there are some who would like sign language classes. That's why there is provision for those made. I just don't believe we're in the position now where we need to put this into primary legislation. But I enter into this genuinely, and I'm content to listen to what it is that the member has to say and the evidence that she brings forward, and we will engage in that in a genuine way. It's also worth pointing out that many deafened adults do not identify with the signing community, as I have said, but there will be an opportunity for that to be further explored. This is a sign language bill designed to recognise both sign languages and to improve the lives of the deaf community. It's not intended to replace existing disability legislation. Rather, it's based around the culture and languages of the deaf community. However, choice and identity are at its core, and my department takes its promotion duties seriously with regards to promoting BSL, ISL and deaf culture as widely as possible across society. Therefore, arising from those discussions with the deaf sector and the Department of Health, my department will fund a limited pilot programme of BSL and ISL classes for deafened adults and their families to assess the demand for such classes and to explore curriculum need as well. The lessons learned from this pilot will be shared with deaf organisations and Department of Health officials to consider the merits of access to such classes alongside the existing supports as outlined. Subject to further discussions with delivery partners, it's anticipated that these classes will launch in the coming weeks. I refer to the reference within this amendment that the Department may, by regulations subject to negative resolution, provide for a fee to be payable for classes provided under subsection 4. And for context, although there is a reference to fees in clause 10, for which there is no intention from my department to collect presently, I have agreed to the Communities Committee request to amend clause 10 from negative resolution to affirmative resolution, given the potential for the collection of fees. The negative procedure stipulated within this amendment to directly impose new fees would be inappropriate for the same reasons and should only be considered under the affirmative process. So, in regards to this section, for the reasons I have outlined, I don't believe that classes such as these require provision within primary legislation. Furthermore, the suggested statutory procedure for imposing fees is inappropriate. Move on to clause 4 and the further amendment by Kelly Armstrong. And as the bill stands, this is unnecessary as the reference to the chapter which clause 4.5 is in, i.e. chapter 1. However, this can be seen as consequential if the member's amendment is successful. So I've outlined my opposition to the member's amendments at clause 2, and I've also outlined my view that if that amendment was carried, then for the purposes of consistency, affirmative resolution is the appropriate route. I'd also refer to my agreement to the committee's request to amend clause 4.5 to replace regulations by negative resolution to affirmative. The member, of course, was part of that committee, and she made her views clear that she was not in favour of the use of negative resolution. That brings us on to amendment number 6. Clause 4 provides the Department with the statutory powers to list in regulations those public bodies which will be required to take the reasonable steps as outlined in clause 3. The amendment is technical in nature and clarifies how the Department must, by regulations, list public bodies as prescribed organisations for the purposes of this bill. The committee had requested that rather than listing public bodies as prescribed organisations by negative resolution, the Department should use the affirmative regulation. My officials were of the view that this was an administrative duty and that negative resolution would provide a proportionate level of scrutiny for such an administrative exercise. It would also expedite the listing of public bodies to ensure they would be subject to the duties of this.
Not interrupting deliberately, but just to point out we're addressing amendments 1 to 5 and then 22. I think you referred there to amendment 6.
Amendment 6, just 1 to 5?
1 to 5.
Then...
And 22.
And 22. Well, then moving on to amendment number 22, and apologise to the House for that. I thought amendment number 6 was in group 1, but if that's not the case, we move on then to a few brief comments in relation to amendment 22. Membership of the deaf community needs to be factual in order to work everywhere else referred to within the bill. Key rights to access services and information correctly turn on the actual use of or reliance on sign language. Therefore, this is not about a hypothesis, an abstract or potential benefit from using sign language, but rather guaranteeing access to services for those deaf or deaf-blind people who normally rely on BSL or ISL in the present. Deaf or deaf-blind sign language learners now, for example deaf children, may well become users relying on sign language in the future and would automatically have rights under the bill at that point. The amendment would undermine the intention and purpose of the bill, as it would place sign language users who rely on BSL or ISL and those who could hypothetically in the future benefit from sign language on an equal footing under defined membership of the deaf community. That's not the intent of the bill, because, Mr. Deputy Speaker, I believe that if I were to learn sign language, I could get a future benefit from learning it. However, I do not believe that I should be in the same category as those who rely on it. That is the distinction between this. That was the policy intent of the bill. Happy to give way to the member if she wants to make any comment on that, but that is the case. That then takes us to the end of Amendment 22 and the end of Group 1, and I beg to move my amendments.
Mr. Thank you. Members, the Business Committee has agreed to meet at 1 p.m. today. I propose, therefore, by leave of the Assembly, to suspend the sitting until 2 p.m. This debate will continue following question time, when the first member to be called then will be the Chair of the Committee for Communities, Colm Gildernew. The sitting is, by leave, suspended.
Assembly Chamber. Sound. 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 Assembly Chamber. Sound.
Okay, members, sitting's resumed. It's time for questions to the Minister of Health. Question 1 has been withdrawn. I call Peter Martin.
Thank you, Mr. Speaker. Question 2.
Thank you, Mr. Speaker. I want to recognise the vital work that community pharmacy teams do each day, ensuring the safe supply of medicines to patients. It's reflected in the considerable investment made by my department over recent years, with an aim of strengthening the role of the sector in primary care, including yearly increases to recurrent funding, annual pay uplifts and exceptional investments such as for national insurance increases. Government funding for community pharmacy HSC service provision has increased by almost 60 million, or 57% since April 2018, and that's the highest level of funding to date and is commensurate with the rest of the United Kingdom. Community pharmacies access medicines via a range of commercial arrangements, and that's with different pharmaceutical wholesalers operating within a UK-wide supply chain for medicines. These commercial arrangements are agreed between the wholesaler and community pharmacy business and operate in a competitive market. Wholesalers compete on price, on service levels, on delivery speed and credit terms. Department officials engage with wholesalers to ensure the continuity of supply of medicines to patients and members of the public is not affected. Notable exceptions, or examples rather, include work related to EU exit, the COVID pandemic, and at times of medicine shortages. Wholesalers have advised of pressures within the community pharmacy sector across the UK, including here. Claims that 90% of pharmacy customers at one wholesaler did not pay their bill in January are concerning for the company involved, and my officials will continue to engage with wholesalers to ensure that the continuity of supply of medicines to patients and members of the public is assured.
Mr. Martin.
Thank you, Mr. Speaker, and I can thank the Minister for his answer and declare an interest as my wife is a pharmacist. Can the Minister state the extent of the concerns expressed by medicine wholesalers to his department about the ability of community pharmacies to pay their wholesaler bills?
Thank you, Mr. Speaker. I am a regular user of medication on a daily basis, and so I can say anecdotally with my own community pharmacist, I have been made aware that they are feeling particular pressures in terms of price points at the moment. But I think it would be fair to say that we are in regular negotiations and conversations with Community Pharmacy NI, and we've yet to find a joint landing space in terms of what we think is the right thing to do in terms of investing in community pharmacy and what they think we need to be doing for them. So I'm not happy that we're not in the same place, and I want those discussions to continue until we find that we're both in agreement.
Philip McGuigan.
Minister, I was at the Pharmacy Awards for the North on Saturday night past, and it was extolling the really good work that our local community pharmacists do in terms of providing healthcare and improving patient outcomes for our community. But notwithstanding that, at that engagement and my committee engagement, I am aware of real pressures within the community pharmacy sector, and the issue of medicine supply, but clawback and core funding are key concerns within that industry. And can I ask if the Minister will commit that he himself will engage directly with community pharmacists in trying to resolve some of these outstanding issues?
I can certainly make that commitment, because I have met directly with community pharmacy Northern Ireland on a number of occasions. Gerard Green, I believe I have a relationship with. But I'm interested in the clawback that the chair of the committee mentions. My department has worked with the Scottish Government to gain a greater understanding of their funding arrangements. The engagement has identified that recurrent core funding levels actually are broadly comparable between Northern Ireland and Scotland. And Scotland's suspension of generic discount clawback has only been feasible due to legacy differences between Scotland, the Scottish and the England drug tariff prices, which are now beginning to align. And now there's a request from Community Pharmacy in Northern Ireland to adjust or remove long-standing discount callback arrangements to allow in excess of 20 million being retained by community pharmacies, but with no additional service provision or benefits for patients or the HSC, and that, I'm afraid, is a bridge too far.
Donny Donnelly.
Speaker, and thanks to the Minister for his answers so far. Ministers, we've heard time and time again from community pharmacists that are struggling to pay their bills, sometimes juggling between different accounts. Northern Ireland Pharmacy is particularly exposed because traditionally we've less wholesalers. One wholesaler has already left Northern Ireland as well. These pharmacists are telling us that they're particularly exposed because of the clawback. They're losing £20 million a year going back into the health service. Will you consider removing this clawback so that we can sustain this important industry?
Thank you, Mr. Speaker. Well, yes, 20 million is the figure that I was quoting to Mr. McGuigan. Clawback arrangements which would allow in excess actually of 20 million to be retained by community pharmacies. The actual annual margin achieved by community pharmacies in Northern Ireland has significantly exceeded the guaranteed level. And coupled with the fact any excess in margin is not recouped by us, the removal of discount callback is not something, I'm afraid, we can consider at this time.
Colin McGrath.
Community pharmacy provides a service that your department has to do. They can't do it with the funding that you're giving them. They are going to collapse. The £20 million clawback, you're suggesting that it needs to be connected to new services. It was put to me recently, that's like giving nurses a pay rise but then asking them to work a Saturday and a Sunday. It doesn't make sense. Will the Minister sit down and undertake himself to sit down with representatives from the community pharmacy sector and hear exactly the way the situation is in the community? Because even some of the figures that he's quoted today, I'm not even entirely sure about them, because we've been told, the committee, that we've been given misinformation that had to be corrected, and I don't know if your pack has been corrected for here today.
Minister.
Thank you, Mr. Speaker. I just assure the member I have sat down, I have listened to the community pharmacy people about their concerns. But what I am told is that provision has increased by almost £60 million since April of 2018. Now, we're coming towards the end of this financial year. We started with a shortfall in the department of £600 million. I said that was unprecedented and unmanageable, and I am correct, because it is only through the up to £200 million from the Treasury Reserve, which we will have to pay back, that we hope to balance the books. So effectively we're finishing £200 million light, and going into next year our starting position is at least £800 million short. So yeah, I would love to do more for community pharmacy. They're central to Shift Left along with GPs. I'd like them to get more. I'd like everybody to feel content when they wake up in the morning and look forward to delivering HSC services. But that's not where we are.
Timothy Gasson.
Question 3.
Minister.
The Northern Ireland Ambulance Service continues to engage constructively with recognised staff-side representatives regarding the current industrial action and associated actions short of strike, or ASOS. Since November of 2023, 3 of the 4 recognised trade unions within NIAS have been undertaking ASOS. The issues raised relate primarily to safe staffing levels, to staff welfare, and to the impact of prolonged hospital handover delays, which contribute to late finishes and reduced opportunities for rest. NIAS has established regular partnership forums with trade union representatives to review these issues, to monitor operational data, and identify actions to reduce the impact on staff. Progress has been achieved across a number of areas, with further improvements expected through ongoing hospital handover reform. This includes the release to rescue protocol, scheduled to go live next month. This will allow ambulance crews to safely return to the community when extended hospital handover delays occur, helping to restore capacity currently lost at EDs. NIAS continues to engage constructively with trade union representatives on the issues underpinning their action short of strike, including staffing, staff welfare, and the operational impact of hospital handover delays. And I'm scheduled to meet with trade union representatives and the ambulance service leadership later this week to discuss these matters further.
Well, Mr. Galston.
Mr. Speaker, the late Willie Dara passed away at the side of the road on the 21st of December 2024 after suffering a heart attack. The initial 999 call from his wife Caroline was classed as a Category 2 call, and due to the action short of strike, wasn't passed to the crew in the local Ballymena ambulance station. Minister, will you commit today to meeting with the Dara family and also ensuring that this action short of strike is brought to an end, to ensure that no other family is left in the same position as the Dara family have been?
Thank you, Mr. Speaker. Well, first of all, my sympathies to Mr. Dara's family. It's a very regrettable loss of life there. Now, I do hope to see improvements in hospital flow. They're expected to help restore the capacity of the ambulance service. And the future operational approach to responding to Category 2 calls in the final hour of shift will depend on the outcome of ongoing discussions with trade union representatives, so I can make no promise there. Regardless, Category 2 calls will continue to remain fully visible, clinically governed, and actively managed at all times, even when immediate deployment is constrained by wider system pressures. And as to meeting Mr. Dara's family, of course, I will agree to that.
Linda Dillon.
Can Corlia, and thank the Minister for his answers. Minister, the release to rescue protocol, is that definitely going to go live in April, as we had been previously told? And what is the impact what impact do you anticipate that will have on resolving the industrial action? And I just want to concur with the comments of Mr. Gaston around the death of Mr. Dara. I think that is very unfortunate, and I know that no ambulance service staff would want to think that they are leaving anybody lying on the side of the road, but unfortunately we are all in a position where we have had constituents that are exactly in that place. That is not because staff wanted to be that way, and I think that we need to be very cognizant of that. So how do we improve that, and what is the impact that you believe that would be had by the release to rest?
Well, I agree with the member. I don't think there's anybody working in health and social care who doesn't want to deliver the best for their patients and their service users. But such are the pressures, particularly around emergency departments, and the member will know this. There are nurses and doctors and our ambulance crew who are trained to do the right thing, the best thing for the patient, but because of the pressures and because of the numbers, too often they end up trying to decide what is the least worst option here. And that's not a single decision. Once you've made one least worst option decision, there's another one in your face, and then another one, another one, another one, for the whole of your shift. And that's why we get to this sense of moral injury and of staff and workforce going home and waking up the next morning and not looking forward, as they should do, to going on shift because they're not seeing any light at the end of the tunnel. Now, in terms of the release to rescue protocol, I have no indication other than it would go live in April next month. What it does, though, is it puts more pressure on the workforce within the ED department because there's going to have to be a handover so that we can release the crew.
Neil McAllister.
Minister for his answers so far. Minister, you just kind of pointed to what some of my question was going to be there. We have heard from some nurses who are concerned, and I know that the Royal College of Nursing do also have some concerns about this protocol, but we do have to do some things differently. However, what has the engagement been like with not only RCM but the emergency department clinicians who are running this on the ground to ensure we have the buy-in, and ultimately who will be looking after the patients that are released to the hospitals so that the ambulances can go back into the community?
Well, as it happens, I was at Windsor Avenue this morning at a conference which is being run by the Royal College of Nursing. So I think the relationship there is good. But I go back to the point that I think I understand the pressures and that moral injury better than I am able to provide a proper solution to it, because that does require more funding and more resource. But in terms of this specific release protocol, I am not aware of any significant concerns, or maybe the concerns are significant, that's maybe a judgment call. I sense a willingness from within the RCN to try and make this work, let me put it that way.
Alan Chambers.
Thank you, Mr. Speaker. I'm glad that a further meeting is planned in the coming days. Whilst ambulance capacity continues to be lost due to prolonged hospital handover delays, I do very much welcome the significant improvements that have been made in recent months. Is the Minister hopeful that whilst all year-round pressures will no doubt remain, we are through the worst of the winter pressures, and therefore securing a sustainable end-of-shift protocol should be more achievable?
I think we are probably through winter, but the member will be aware that very early on I stopped talking about winter pressures and described them as additional winter pressures, because the pressures are on 24/7, 365. I am confident that we are moving in the right direction. I'm not satisfied that we're moving as quickly as I would like, but in the real world I think everybody is focused on trying to do better, and I'm very grateful to the staff and the workforce in health and social care, not least in emergency departments, who are trying to push for better.
Anna McCrossan.
Thank you, Mr. Speaker. Thank you, Minister, for your answers so far. Minister, in the last year, £10 million has been spent on private ambulance providers. Would this money not be better spent on the Northern Ireland Ambulance Service?
I recognise the point that the member is making. If we had a blank map and we were starting from scratch, absolutely. But we're in a position where the pressures, to some extent, are unprecedented. And if we don't spend the money on those independent services, then people don't get seen in a timely manner, or even less timely manner than they're being seen at the moment. So in an ideal world, absolutely. Is it a position I would like to move to? Absolutely. Would I like to be spending less on the independent sector generally? Absolutely. But we don't have the capacity to do what we need to do within the HSC.
Justin McDelty.
Kirsty Carr.
Minister.
My department implemented the new Management of Violence and Aggression in the Workplace framework in December 2023. The framework outlines the HSC's commitment, development partnership with staff representatives to ensure the prevention, the reduction and the management of violence and aggression towards staff in the workplace. Since its launch, all HSC organisations and key stakeholders have been working to embed the framework's principles and support local implementation. I am clear that creating a culture of zero tolerance towards violence and aggression in the workplace is not a one-off action, but a sustained commitment. Every member of staff has the right to feel safe and respected at work, and we will continue to take all necessary steps to protect and support our workforce. HSC trusts have a number of measures in place to protect frontline staff, including safety intervention training. This helps equip staff with the skills to identify potential risks and effectively de-escalate situations. There's also the use of trained security staff who respond to incidents 24/7. There's CCTV coverage, which is effectively used to deter and detect criminal and antisocial behaviour, and the use of body-worn cameras. A number of trusts are currently piloting the use of these cameras, They act as a potential deterrent, and they allow staff to capture video footage of instances of violence and aggression. I would welcome a change in the law that would strengthen employers' ability to support the progression of incident reports to the PSNI.
Mr McNulty.
Thank the Minister for his answer thus far. Minister, 72,000 physical and verbal attacks on health and social care staff in the last 5 years in the North, sometimes in circumstances where there is no blame, where there are Alzheimer's patients and mental crisis patients who act unpredictably and violently towards staff, causing harm also physically, emotionally, and you mentioned moral injury earlier. Physical and emotional injury is actually happening in the workplace. Minister, is enough being done to keep staff safe?
Well, it would be tempting to say we could never do enough, but we are certainly, once again, moving in the right direction. I'm very much in favour of body-worn cameras. I think there is evidence that they are a successful and appropriate deterrent for action. Where I am focused, I will tell Mr McNulty, is on changing the law, which at the moment prohibits the employers, the trusts, from taking action in terms of a prosecution of somebody who has been violent, either physically or verbally, against a member of their staff. And we are actively looking at what we might do by way of a legislative change which would empower the trust to do more, to ensure prosecutions, rather than leaving staff feeling that they're on their own. They have to go and get their own solicitor and do their own prosecution.
Thank the Minister for his answers thus far, and you've just referred to the fact that you support the use of body-worn cameras, and I welcome their introduction first at Antrim and then in the Ulster Hospital. Can I ask what plans you have to roll those out regionally across all trusts? And can I also ask, when you refer to the legislation element of this, and I know that the Justice Minister has spoken about including assaults on frontline workers as an aggravator as part of the sentencing bill, what conversations you've had with the Justice Minister to bring that forward, and how that could impact this?
Well, the pilots will run their course. It would be my hope that we will end up with body-worn camera being available to all HSE staff who are working in areas where there is that engagement with patients, stroke service users, where it is appropriate. But it will be for the trusts, ultimately, as it is an operational matter for them. What I would like to see is that it is consistent and regional across the 5 geographic trusts. I don't think we should end up in a position where one trust does one thing and another trust does another, because that just doesn't appeal to me. In terms of my conversations with the Minister for Justice, yes, we have sat down face to face. We have discussed this particular issue. We have discussed the fact that the employer does not have any legal vires to step in and protect and operate a prosecution on behalf of their staff. And we think we have a workaround, which would be in legislation which I would hope would be passed through this Assembly chamber before we hit PERDA, which I believe may kick in 1 year tomorrow.
Wilson.
Thank you, Minister. And like other members, I welcome all efforts to protect our frontline healthcare staff from physical harm and harassment. Minister, is there evidence in the circumstances that have been brought to you where violence can be carried out within our healthcare settings, that the basis of that is substance misuse?
Yes, certainly anecdotally, it seems to me that if you visit emergency departments or the environs of emergency departments, you will find people who have taken substances, including illegal substances, which are the motivator for violence, both physical and verbal, against staff. I would say to the member, well before, it was actually before COVID, I was fascinated to be told that Monday nights are the busiest in emergency departments because some people don't want to give up their weekends, so they kind of thole it until they get to Monday morning. So I asked to spend an overnight in the Ulster Hospital. And one of the things that happened was a man came in by ambulance full of alcohol. They found a chair for him, and at around 2 o'clock in the morning the chair was empty, and I said to the nurse, "So have you managed to deal with this gentleman?" They said, "No, he's gone." But a couple of hours later he arrived back, second ambulance. He'd gone home for a drink. He had gone home to get himself a drink. And could I just also say, in terms of body-worn camera, yes, I support them. And yes, it's a good thing, potentially. But it's also a very sad thing that we have come to that position where we need them.
John Blair.
Thank you, Mr. Speaker. Question number 5.
Minister.
Thank you, Mr. Speaker. Data definitions do not directly measure or describe pressure within health and social care. Rather, they serve to enable the consistent recording and reporting of information right across the sector. This consistency supports robust assessments of system pressures using both statistical and operational data. The Department makes use of a combination of official statistics and management information grounded in standardised data definitions, which we use to evaluate pressures within health and social care environments. This is further supported by statistical quality assurance processes, ongoing collaboration with data producers through its system, and regular reviews of both data definitions and sources to ensure continued relevance and accuracy in reflecting operational realities.
Mr. Blair.
Mr. Speaker, I thank the Minister for that reply. But on the subject of data, can I ask further to the question? Given the BMA's warning that consultant vacancies may be significantly underreported because only posts under active recruitment are actually counted, does he accept that decisions may be flawed if the data he referenced previously understates the scale of need?
Well, the logic of that is yes, but what I would say to the member is there is a logic to only reporting vacant positions that are under active recruitment, and that is because we are so strapped in terms of the funding for the department that that is almost an inevitability. Does it skew the risks? Does it skew the shortfalls? Off the top of my head, I'm saying to him, yes, I would like to know exactly what is missing rather than what we are trying to fill.
Dan Dodds.
Minister, we all welcome the reduction in waiting lists, and I think that is a really important and valuable and good steps forward. But recently in the Health Committee, we had a number of presentations which talked about very large reductions in waiting lists of over those who'd been waiting 4 years and more. And the South Eastern Trust came in 2 weeks ago to tell us that they'd had a 60% reduction in their waiting list. When I asked them, so that figure then fell from 20,000 something or other until about 8,000. I haven't the exact figures in front of me. When I asked them to detail for us how many of those people had actually been treated, they said that they didn't know. Do you not think that data, particularly data around waiting lists, needs to be accurate, transparent and full of information?
I absolutely do. I think the member is maybe suggesting that some of the reduction in waiting lists isn't through activity beyond validation. Maybe, maybe not. Validation is a very important and necessary process. But in terms of, by the end of the year, which is a couple of weeks away, a week or more away, I want to know, in terms of the programme for government target, not that we have exceeded the 70,000, but how we have exceeded it, broken down by appointments, diagnoses and procedures. And that, by necessity, would involve knowing the numbers trust per trust. So I was not aware of that experience that the member had with that trust, but it is something I would like to rectify as we come to financial year end.
Orla Flynn.
Minister, I've been informed that the publication of the quarterly CAMS data has been paused until quality assurance is undertaken. That was something you referenced in your original answer there to John Blair. I was just wondering if you can elaborate a wee bit more on why that is the case, or that process that's being taken forward.
I'm afraid I'm not aware of that specific, but I can take it away and ask officials to bring me up to speed. But sometimes with the rollout of Encompass, we are still saying that these data sets are not validated yet, and I have to accept 2 years, it seems to be the norm for bedding in a system like Encompass. It seems like a long time to me, but it is what it is.
Well, sure.
And I thank the Minister for his answers. Minister, data and understanding data is hugely important, particularly in the health service, which sees a high volume of patients in high-pressure environments. How do you believe Encompass will help better understand pressure and alleviate it?
Thank you. Well, by standardising data capture, improving timeliness and reducing manual returns, Encompass will enable more consistent and reliable analysis of the flow, the demand and the capacity. It's already supporting improved reporting in areas such as inpatient escalation beds. Further work's underway to complete ED corridor care reporting. That's very important to me. And reduce reliance on manual manipulation of extracted data. It's going to give us real-time, consistent data in terms of the pressures right across the health and social care system. But as I said to Ms Flynn, it is going to take a bit of time to embed, and actually the best description I've had from somebody working in the system is we have an engine to get us to the moon. At the moment we're only using it for a short break, so the potential remains absolutely massive, particularly for public health initiatives.
McGrath for topicals.
Mr. Speaker, Minister, are you aware that while you were enjoying the festivities in America over St Patrick's Day, that the urgent care centre at the Down Hospital had to be downgraded for the day to a minor injuries unit?
Well, the member may categorise my trip as he wishes, but I met a lot of providers of healthcare in Nashville, and as we speak, they are upstairs at a follow-up meeting. So I think some progress has been made in terms of cooperation on healthcare initiatives. But I was not fully across what the member says. I wasn't fully across what was happening in real time in health and social care delivery.
Mr. McGrath.
Well, Minister, I appreciate that you were obviously busy in America, but the Lagan Valley and Ulster were able to maintain their urgent care centres on the day, but it was the people of Downpatrick on its busiest day of the year that were left short in the Down Hospital. And I wonder if you weren't aware of that. You weren't aware about ambulance response times in South Down when I asked you previously. I wonder, were you aware that over the last 5 years, 1.8 billion has been spent by health trusts on agency and locum staff? So, Minister, is it a case that your advisors aren't telling you what's happening, or is it that you're just not interested in the realities of the health service?
I am aware of the 1.8 billion spent on agency staff, and that was agency and locums between financial year 2021 and 24-25. We incur that expenditure to ensure safe and effective services are sustained, so it is important we do it. It increases short-term capacity, and given the current gap between demand for care and the system's capacity to meet that demand, it is crucial. Reducing agency spend is, however, a key priority. We're committed to bearing down on this cost. It will not be possible to completely reduce the cost because we have to maintain the services. So yes, I am aware. I'm aware we've done good things elsewhere in terms of reducing agency cost, and we now look at locums, and we will continue because there's certainly a start point to financial savings in health and social care, but there is no end point.
John Burrows.
Thank you, Mr. Speaker. I was delighted to see the Minister in America last week engaging with health leaders and professionals. Could he outline what the key takeaways were from his visit in America, Washington and Nashville?
Thank you, Mr. Speaker. Well, I think in Nashville, the member will be aware I have a passion for trying to address health inequalities. They have them in a very similar manner. In Nashville, I was at Meharry medical centre. It was the first in the United States exclusively for Afro-Americans. And it was very affirming to discuss the social determinants that they are trying to tackle and to discover the same social determinants that we are trying to tackle. Another major takeaway was visiting Belmont University and their SIM centre, as they call it. It's a simulation centre. It's a training centre. It is, to my mind, it is out of this world what they can do in terms of training doctors and nurses. And very gratifyingly, they're very keen to form a relationship with Northern Ireland, and we will be trying to connect them to the right officials and quite possibly to our two universities. But perhaps the most important thing was in Washington going to visit the National Cancer Institute. There's been a tri-jurisdictional relationship between Belfast, Dublin and Washington on foot of the 1998 agreement, and the first formal memorandum was signed in 1999. And I still find it hard to believe that I'm the first Northern Ireland Health Minister in 27 years to visit the National Cancer Institute in Bethesda. And it was pointed out to me that in the current political atmosphere in the United States, all those relationships are examined very carefully to make sure that they are a two-way street and that America isn't simply offering help and resource and finance to foreign countries. So I think it was very timely to visit particularly the National Cancer Institute in Bethesda.
Mr. Burrows.
Thank you, Mr. Speaker. It's good to see the Minister looking up and out for best practice across the world. Will he be instructing his officials to do any follow-ups, particularly with US training colleges, to embed those transatlantic practices?
Thank you, Mr. Speaker. Yes, certainly with Belmont University, there is a very clear need and a desire on their part to follow up. Mahari were also keen to follow up, to talk about those social determinants of health inequalities. And the National Cancer Institute continues to have the relationship with the Department of Health and indeed with Queen's University. And it was interesting because I was accompanied by Professor Mark Lawler, who has many titles at Queen's but is basically the lead man in terms of cancer research. It was interesting to see with the respect and the esteem in which he is held, and that's because he has spent a lot of time and effort forming the relationship with the National Cancer Institute, and that is something that we need to do as a Department of Health.
Colin Cullen.
Collier. Minister, you will be aware of a number of constituents, certainly have approached us all, but in North Belfast a number of constituents and indeed some GPs have came to me with growing concern around their patients, our constituents, having to go to the private sector to get diagnoses for ADHD. And when a medication is given, the GP cannot prescribe that medication without a referral from a consultant. How are you going to change this inequality?
This is a major challenge, and I accept it, and I've been contacted on many occasions, and I have met actually parents of children who were on medication which had been privately prescribed, and then the prescriptions were no longer being honoured. And I understand the GP has no obligation. They are encouraged to look at whether it is basically within their competence and within the rules of their governing body, of the BMA, etc. So there's a whole kind of set of criteria that they can look at. But this is happening, that children are not getting the medication. And again, why are people going privately? Because the waiting list in the health service is far too long. So they're going through love. They love their child, they don't want the child to wait, so they go. Do I have a ready solution? I'm afraid I do not. Is it on my radar? Absolutely it is. And am I looking for a solution? Yes, I am.
So the response is that we are going, it's not just children, it's adults as well. And recently we met with the Belfast Trust and raised this issue with them also. As Minister with the lead responsibility, can I respectfully suggest you get them all together? Because for someone who champions inequality in health, this is one of the greatest that people are having to pay having to pay for peace and quiet and having to pay for medication that should be available. So the professional bodies can't do it, the SPPG can't do it. So can you get the CMO, the SPPG, the professional bodies and trade unions together and talk to them about addressing this gap, which is getting bigger as we speak?
Well, the member will be aware that I commissioned some academic research into the prevalence of ADHD. We've had that report, and I've now asked for an options paper, and I will make this promise to the member that I will bring those people and organisations together once we've got that options paper to look at what is the best solution.
Gemma Dolan.
Minister, you recently visited Rathmore Health Centre in Ballick, which I'm very grateful for you doing so. However, a number of services have been removed from the surgery, such as dentistry, chiropody and midwifery. Can you commit to working with the practice to get these services reinstated?
I couldn't make that commitment standing here today because I'm not sure of the implications. I'm not aware of why those services had to be withdrawn, and therefore I think it would be foolish of me to make a commitment to reinstate them when there may be good reason why it is not going to be easy or possible to reinstate them. But you put it on my radar, you want me to go and ask the question, and I'll do that.
With you in writing about the issues as well. But following on from that, could you give a commitment to ensure that rural communities like Ballick are not disproportionately impacted by the loss of essential health services in the future?
Sure. Well, I think one of the advantages or benefits to me of going to the visit with you down in Ballick was to be aware that there aren't simply specific challenges in terms of rural health delivery, but rural and border health delivery is a particular challenge, particularly when we think about the fact that we cannot compete with Laochra Care in terms of wages and salaries. So it is very attractive for healthcare professionals who are working somewhere like Ballick to look over the border, and that's perfectly understandable. So yeah, it is important for me to get out and about. Mondays and Tuesdays, I'm either in here or the department, doing meetings, doing paperwork. It's all essential work, but it's not real. It's only when I visit somewhere like Ballick and that GP surgery that it becomes real, and I get a better sense of what I need to do.
John Blair.
Mr Speaker, I'd like to ask the Minister, given that Northern Ireland is currently the only part of the UK not participating in the National Diabetes Audit, if he could outline whether his department has a plan or a timeline for implementing a bespoke diabetes audit here in Northern Ireland.
Yes, I am aware we're the only part of the United Kingdom who are not participating in it. I want us to participate in it, and in fact officials do not disagree. They want to participate in it as well. There was something missing, and I'm having a mind blank here. There was something missing that we have now rectified in terms of our diabetes service, if I may put it that way, which, as I understand it, opens the door for us to participate in the national survey. As for a timeline, I'm going to request the member lets me get back to him because I want to go and check it. I think we're nearly there.
Mr Blair.
Thank you, Mr Speaker. And I thank the Minister for that answer, and if we can try to tease out some more detail either today or in that further information forthcoming. Can I ask the Minister to accept that if we are serious about reducing complications and improving outcomes in diabetes, we need not just activity data, but credible creditable audit framework that shows where care is working, where it is variable, and where improvement is therefore needed.
Yeah, I think these are all really important questions that the member is posing, because I think there are those within health and social care who know a lot more. They're much better qualified as clinicians and as operatives, who think type 2 diabetes could be like a total epidemic that could absolutely flood our ability to deliver health and social care. So it's a really important area that he's identifying, and important issues as a kind of substructure to that, yes.
Garth Wilson.
So you'll be aware, and there is a concerning trend, and it affects my constituency as well, being largely rural, and that's around fulfilling domiciliary care packages in a reliable and consistent manner. And I'm concerned in recent days that a provider has decided to reduce and withdraw services to elderly patients in the sort of wider Market Hill and surrounding areas, and that's impacted a number of families who are now in some difficulty in terms of ensuring that their loved ones are cared for adequately at home. What plans have you to enhance the provision of domiciliary care in rural areas in the Newry and Armagh constituency?
Well, I don't have any specific plans for Newry or Armagh rurally, but I do have plans for the whole of Northern Ireland, and I accept some of the challenges for providing in rural areas are more severe than in urban areas. The member will be aware that the most important thing that I wanted to do, and it's the one that has caused me most pain, is not yet introduce the real living wage, and I think that's going to be incredibly important for trying to bolster the existing workforce and make it more attractive for new recruits. I mean, I've said many, many times, to deliver health and social care, you need 5 things. You need buildings, you need beds, you need equipment, you need medicines. But those 4 don't count unless you've got the 5th, which is the workforce. So what am I doing? I'm focusing on the workforce. Community capacity, if we're going to shift left, is absolutely critical.
Mr. Wilson.
Would you agree then, just on the back of that, that having a responsive and reliable domiciliary care service in the rural community would greatly assist in reducing pressure on beds within our hospital system?
Well, absolutely. I mean, I think it was last winter that there was a series of days in January where 400 plus people were in emergency departments having had decisions to admit but weren't able to be admitted because there were no beds available. But the number of people who were in those beds who had been deemed fit for discharge was over 500. So, if you can crack the discharge, then you crack the emergency department queue. So, absolutely.
That concludes questions to the Minister of Health. We now move back to the Sign Language Bill, and I call the Chairperson of the Committee for Communities, Mr. Colm Gildernew.
Con Comhairle, as Chair of the Committee for Communities, I rise to speak on the Sign Language Bill. I welcome members of the deaf community to the Assembly today and welcome those watching here in the gallery and online. I would like to thank all of those who gave evidence on the Sign Language Bill. With your indulgence, Mr. Speaker, before I address the amendments, I wish to make some general remarks about the bill in my capacity as the Chairperson of the Committee for Communities. It is a huge honour to stand here today on behalf of the Committee for Communities to take part in the consideration stage of the Sign Language Bill. This is a momentous occasion for the deaf community here in the North who have waited with extraordinary patience, resilience and determination for this legislation to become a reality. This bill is a transformational step toward breaking down those barriers, providing formal recognition for ISL and BSL and ensuring that sign language users have their linguistic and cultural rights respected. It provides for official recognition of BSL and ISL as languages here in the North with equal status, a statutory duty on prescribed public organisations to take reasonable steps to make their services accessible to sign language users, a commitment to promoting the use and understanding of sign languages, including greater access to sign language education for deaf children and their families, and a framework for accrediting sign language interpreters and teachers, ensuring professional standards and capacity building within the sector. This bill moves beyond disability legislation, recognising that sign language is not just an accessibility tool, but a core aspect of cultural and linguistic identity. We believe the committee's scrutiny of the bill has added to the strength of it. The committee sincerely hopes this marks a step change in how accessible public services will be for you, and that your lives improve because of it. We will be advising the next Committee for Communities in relation to follow-up scrutiny of the legislation's implementation. The committee supports this bill. During our scrutiny of the bill, members of the committee became acutely aware of the social exclusion deaf and deafblind people can experience as a result of linguistic exclusion. We learned firsthand about the scale and extent of the negative impact of being unable to have access to and participate fully in education, employment, health, the justice system, the arts, leisure activities, as well as to public and private services more generally. While outside the scope of this bill, I will return to what are services provided by the public, but not by public authorities soon. The fact that the requirements of this bill will apply across the executive and will be for each department to deliver, not just for the Department for Communities, is crucially important. The committee looks forward to seeing how each department develops and implements its respective sign language action plans in due course, not least that of the Department of Education, where stakeholders were clear that early education and exposure to sign language will be essential in meeting the aims of this legislation. The committee is also supportive of a number of amendments being brought forward by the Minister. The committee engaged constructively with the department and proposed a number of specific changes where we considered improvements could be made to the bill. These discussions have informed a range of amendments before the House today. Many of you will know how unique the committee stage of the Sign Language Bill was, and indeed needed to be, in order to enable and encourage members of the deaf community to engage fully with it and allow committee to receive what turned out to be invaluable evidence. The committee stage included working with the community and the department to facilitate capacity building events prior to the bill's introduction, enabling evidence to be signed and sent via WhatsApp, providing two-way live interpreting at committee meetings, and when the committee considered the bill more generally, making sure consideration of the bill was clipped and interpreted in both languages post-meeting and then made available on the Assembly website, as well as facilitating specific events with children and the deaf-blind community. Based on the unique approach proposed by the committee, this House agreed to a committee stage of almost 11 months, which enabled us to hear directly from the deaf community here. They have reflected to us how involved they felt in that process. The committee's call for evidence received responses from 42 organisations or individuals via Citizen Space and 44 signed responses via WhatsApp. We requested evidence from relevant organisations and briefings from the Department for Communities throughout our deliberations on the bill. The committee considered the provisions of the bill over the course of 13 meetings and heard from 18 stakeholder groups. A wide range of issues relating to sign language and interpreting provision were brought to the committee's attention, and I intend to go through each of these in turn before I focus in on the amendments listed today. So in relation to services provided in the public sphere, whilst outside the scope of the bill, accessing those services which are available in the wider public sphere but which are routinely provided by private sector companies and organisations was an issue that was raised with the committee consistently. Respondents told us that everyday activities that cause challenges, be that going to hairdresser, knowing how to pay utility bills or when to pay utility bills, grocery shopping, communicating with a solicitor, or just socialising out and about on public transport, all provide unique challenges. Committee has outlined this issue in the recommendations section of our report. As a committee, we feel strongly that it is important for the department to continue to expand access and interpretation on its agenda in terms of sign language provision, to promote consistency of access across society and for essential aspects of everyday life. This has been done successfully in other regions through the use of enhanced voucher schemes and providing access to a central VRS or known as video relay service. In relation to enforcement, this was consistently raised across the committee stage of this bill. As it stands, if public authorities don't provide interpretation, for example, deaf people will have to navigate each organisation's respective complaints procedure, which the department must ensure it delivers clear guidance on, or use the Disability Discrimination Act to take a judicial review. This is clearly not ideal for a piece of legislation that acknowledges the deaf community, not through a disability lens, but as a linguistic and cultural minority. In our report, committee has recommended that the department make full and appropriate use of its regulation-making powers set out in Clause 7 as soon as it becomes apparent that guidance alone is not enough. It is important that deaf and deafblind people, after this bill is passed, do not need to identify as disabled in order to be able to access a linguistic and cultural right. There was significant discussion in relation to the duty placed on prescribed organisations to take reasonable steps to ensure that services and information are accessible to sign language users. Committee was clear that the department, within its guidance, should provide greater clarity on the application of reasonable steps, ensuring that considerations of affordability and practicability do not result in reduced standards of access for the deaf community, and that services are as accessible to them as to the hearing people. In relation to sign language action plans, as mentioned, members considered the broader ambition of the bill in promoting the use and understanding of sign languages. Evidence highlighted the importance of sign language education, and while the bill provides for this for deaf children and their parents, it was not clear how it would be included in the education system. The department did indicate to us that it could not confer functions on other departments, and so it is now over to each individual department to develop their sign language action plans and tell the public how they will each promote the use and understanding of sign languages. In relation to this and many other issues raised with committee guidance will be central to the effective implementation of the legislation. It is important to note here that despite requests for a draft of the guidance and being told the department was working with the BDA on this came in the last month of committee stage, and it was what appeared to be a very early short draft of the guidance to come. In terms of consultation, how the department will consult with the deaf community on various aspects of the bill was also consistently raised. Officials made it clear that for the most part this will happen through the Sign Language Partnership Group, which the department expects other departments to use. The committee recognised the importance of meaningful consultation with the deaf community and strengthened this duty through its request to change Clause 5 and 8 from requiring consultation with one person or group to at least two persons or groups, whilst ensuring this included both BSL and ISL representation. And I have to say it was also clear through the committee stage that the department had consulted widely with the community as well, and that's to be hugely welcomed. So in terms of interpreters then, the implementation of this bill will undoubtedly require more interpreters to be available to the deaf community, and indeed the success of the bill will depend on that being the case. Committee understands the extent of the work already underway to address this in advance of the bill receiving royal assent. However, some concerns do still remain that available interpreters in the ground are few here in the north. The committee has recommended in our report that the department produce a clear strategy to address the supply, accreditation, regulation and retention of sign language tutors, interpreters and specifically deaf-blind interpreters, where the committee understands there is a considerable gap. In terms of the specific needs of the deaf-blind community, committee held a bespoke engagement directly with people here who are deaf-blind and the organisations working to support them. They were clear that there are services for blind people and services for deaf people, but these may not be suitable for deaf-blind people. The department must ensure, therefore, that the specific needs and experiences of deaf-blind people are explicitly reflected across all aspects of implementation, including interpreting provision, social work services, access to healthcare, transport and reporting mechanisms. The committee would like to sincerely thank colleagues in Information Services and Broadcasting, the Bill Office, RAISE, Legal Services, Events, Education and Engagement, and the interpreters for all of their support during the call for evidence and scrutiny of the bill, and departmental officials for their support and patience with the committee's queries. Particular thanks must go to members of the deaf community who took the time to provide evidence in their first language, both British Sign Language and Irish Sign Language. Their contributions were invaluable to shaping the committee's deliberations. I thank the members of the committee also for their contributions to the careful scrutiny of the bill and the issues that were raised in the evidence during the committee stage. There was a shared recognition of the importance of getting this legislation right and of ensuring that it delivers tangible benefits for deaf people and sign language users right across the North and makes a real difference to that community. So now moving, Ceann Comhairle, to Group 1 amendments, sign language classes and definition of the deaf community. Before commenting on the specifics of Amendment 1, it's worth noting that in its report, Committee advised the Department to make what is meant by promote in Clause 2 explicitly clear in the EFM. For example, that it includes an obligation to, but not limited to, the provision of the availability of classes. Committee welcomed the inclusion of free of charge from the Minister, which clarifies that the burden of cost for classes will not be on the family of the deaf child to meet. It is right that children, close families, guardians and carers can learn to improve proficiency in sign language at no cost to them. Amendment 2 is a consequential amendment to Amendment 3, which the Committee requested. That is that the age of a child or young person who can gain access to free sign language classes be increased from 19 to 25. Committee heard from stakeholders that aligning the bill with UNCRPD and indeed UNCRC standards would ensure continuity of access during transition years. The Department received further clarification and rationale from National Deaf Children's Society on this change and indicated that it was content to proceed with it, and I have to say that's hugely welcomed by the Committee. I think that's in keeping with how we approach other sectors in relation to transferring and transition. Amendments 4, 5 and 22 were tabled by Kelly Armstrong after committee stage, and so committee didn't take a view on these. However, Kelly did raise her intention to table an amendment, and members can of course take their own party view on those today. In terms of Amendment 4, I will say, and the member will speak to her amendment soon, Kelly is a strong advocate for the deaf community, and her amendment relates to availability of classes for people over 25 who become deaf and their close families and carers to learn or improve proficiency in the language. Additionally, bearing in mind the cost of this to the Department and presumably to make sure this doesn't halt the availability of classes for young people and their families, she has included a provision for these classes over 25s to be paid for. At committee, the member recorded her dissent regarding agreement of Clause 2 to which this amendment relates. She indicated that while the targeting of young people was welcome, concerns remained that those people over the age of 25 who become deaf through illness or injury are not included to be helped to learn or improve their proficiency in the language. In the Committee's report, we outlined that it too remained concerned about the exclusion of people over the age of 25 who will lose their hearing through illness or injury, and asked for assurances that other policy areas will support such people to be able to communicate in BSL and or ISL. This also relates to Amendment 22 in the group, in use of the term normally, rather than use of would benefit from using. So that completes my remarks in relation to the amendments listed in Group 1. Ceann Comhairle.
Thank you. I call Mark Durgan.
Ceann Comhairle. I rise today on behalf of the SDLP. We are the official opposition, but on this occasion there won't be any opposition from us to what's in front of us today, any of the proposed amendments. It would be great to see us all in agreement on something. That doesn't happen in here very often. This is an important piece of legislation, as others have said. It's one of immense value that matters, that will make a real difference in people's lives. It will make our things that little bit easier and fairer. And it's good to be reminded that's exactly what this place is meant to be about, and that's what we are meant to be doing, delivering improvements for the people that we represent. I want to thank the officials and all those who put so much work into this to date, the officials in particular, their engagement, their willingness to listen and take on board most of committee's suggestions, and I thank everyone who took time to respond and contribute along the way, and especially to the deaf community whose input has been vital. Because of all that, that was good legislation is now on the verge of becoming better legislation. For most of us, understanding and being understood is something we take for granted. We move through our daily interactions without giving it a second thought. But for so many in the deaf community, that's far from the case. The consequences of not having access to the right support can be dire. Recent reports have highlighted deeply concerning cases where interpreters haven't been available in healthcare settings, resulting in misdiagnosis. In some instances, individuals receiving a cancer diagnosis felt that they were left trying to grasp life-changing news without the support or understanding that they needed. Receiving that kind of diagnosis is extremely difficult under any circumstances, but not being able to fully comprehend what it means makes an already distressing experience completely traumatic. Many individuals find themselves relying on family members or friends to interpret at GP or hospital appointments, giving up privacy just to understand information about their own health. The same barriers present themselves across education, in the justice system, and access to welfare everywhere. That's the reality that this bill seeks to confront, stamping out those inequalities that jeopardise access to the basics and allow people to be left behind. And too often these inequalities come at the cost of independence. So it's in that context that I turn to the amendments before us today. We welcome, obviously, the progress of this bill, its clear commitment to promoting and protecting both British Sign Language and Irish Sign Language. I acknowledge that it was remiss of me not to acknowledge that the Minister's work on this and that of my committee colleagues, but in particular, this is probably unusual in here as well. I'd like to pay tribute to the committee colleague from a different party, Kelly Armstrong, for her efforts to date on this legislation. This legislation, I hope, will set out a clear direction and help inform the kind of society we want to build. We support the Minister's amendments today, which for the most part address concerns and take on board issues raised by committee and either tidy up or strengthen the bill, and in many cases do both things. The bill already makes provision for sign language classes for young people under the age of 25 and for their families, guardians and carers. That's welcome and necessary, but we don't think that it goes far enough. Across the north, there are growing numbers of adults who lose their hearing later in life, whether through age, illness or other factors. These are people who often find themselves navigating a sudden and profound change in how they communicate with the world around them, and too often that change can prove isolating. No longer able to follow conversations at home, where communication in the workplace has become almost impossible, or socialising becomes too anxiety-inducing. Without access to the right support, those individuals risk becoming invisible and ultimately suffering a much poorer quality of life in their later years. The bill in its current form doesn't make sufficient provision for those individuals, and we hope to have this addressed by the end of today. Legislation of this kind shouldn't be framed too narrowly. The amendments 4, 5 and 22, in the name of Ms Armstrong, seek to address that gap directly by extending access to classes to all those who will need it or benefit from it. It also provides the Department with the flexibility to introduce a fee for these classes on a cost recovery basis, should it choose to do so. That's a sensible approach. The Minister in his opening remarks cited as low demand the reason for not wanting or needing these changes on the face of the bill, but has stated his intention to roll out a pilot project to ascertain demand. If we are serious about breaking down barriers, then those barriers need to be broken down for everyone, not just those born into the deaf community, but those who come into it later in life. And on the subject of sensible approaches, Amendment 3 further addresses this gap by providing more inclusive language that acknowledges those who acquire hearing loss later in life as well. Taken together, these amendments are relatively minor but extremely meaningful. They recognise that deafness happens for a variety of reasons, that communication needs can arise at any stage of life, and aims to ensure that this bill reflects that reality in a way that is both practical and forward-looking. Amendment 22, I understand entirely where Ms Armstrong is coming from and where she wants to go with this amendment. I'm not going to steal her thunder on it. It's a bizarre situation when I'm speaking on someone else's amendment. It is very much her amendment, and she'll soon explain it, but I am supportive of her aim. I do, however, acknowledge the Minister's concern here as well, and would encourage him to work with the proposer, with the committee, with the sector, to maybe come up with a formula of words somewhere in between who normally use and who will benefit from using at the further consideration stage. I appreciate that there's been a discussion about what should or should not be prioritised at this stage, but legislation should set out a clear direction of travel, and these amendments, in my view, do just that. They provide flexibility to the department, they introduce safeguards around costs, and they expand the scope of the bill to include those who otherwise would lose out. This bill can't claim to break down barriers, but still leave some people standing behind them. If we're serious about inclusion, then we have to include everyone who needs this or who will need that.
Kelly Armstrong.
Thank you, Mr. Speaker. I am a member of the deaf community. I am hard of hearing. This sign language bill is very important to me and to the deaf community. I have worked very hard to make this bill the best it can be. Mr. Speaker, I will hand over to an interpreter and I will speak the rest of my statement. Mr. Speaker, people who use sign language have waited years for this legislation. As this bill proceeds through its consideration and final stages, they will be able to see how much has been included in the legislation. When it becomes law, the new Act will see a vast improvement in the provision of sign language across all public services. There will be significant support for children who are born deaf or with significant hearing loss, whose lives will be greatly improved by the availability of sign language and sign language classes for them and their families. Today, we have the opportunity to bring amendments that improve the intention of this vital legislation. The amendments presented today come after considerable consultation with the deaf community, and I am grateful for the work of the Committee for Communities, the Department of Communities, and the very many individuals and organisations that have helped to finesse the bill we have in front of us. Following ongoing consultation with the deaf community, I have brought forward 3 amendments to extend provision of sign language classes directly to adults, like myself and many others who have lost hearing in later life. These 3 amendments are part of Group 1 and are Amendments 4, 5 and 22. None of these amendments should come as a surprise to the Minister, the Department or to the members of the Communities Committee. I have raised issue with this section of the bill several times, as confirmed on the record in the Communities Committee and in the subsequent report. While the Department have kindly agreed to bring forward a number of amendments suggested by the Communities Committee, I believe an important consideration has not been included, and now this Assembly has the opportunity to include the needs of people who become deaf in later life. This includes people who become deaf due to age, illness and/or trauma, and this includes serving military, police personnel and veterans whose hearing has been impacted by loud noises such as explosions and from firing ranges. People who work in industries where repeated loud noises have damaged hearing, such as manufacturing, aviation, construction, fitness industry, musicians, hospitality, waste management and recycling. And important not to forget people who've been in receipt of chemotherapy, radiotherapy and those with some cancers whose hearing can be damaged through the receipt of life-saving treatments. It includes older people who have age-related hearing loss, presbycusis, who have had infections. Viral infections can lead to hearing loss, especially in older adults. People with illnesses such as Meniere's disease, systemic illnesses and some cancers. Hearing loss, as others have said, leads to isolation, loneliness. It reduces opportunities. It removes a person's ability to communicate and for others to communicate with them. Some have had to leave work, others to stop socialising. The lack of access to two-way communication means having to forego privacy, as we have to depend on family or friends to listen and clarify what a doctor or a consultant says during an appointment. We have a growing number of older people living in residential care, cut off from others because their lives have been reduced to isolation and loneliness because they cannot hear. Not having access to learn to communicate with others, or for others to learn to communicate with them, leaves them forgotten, receiving less public service and making their older years very unpleasant. I appreciate there have been some discussion about what actions should be included in the bill and the departments need to prioritise sections. Mr. Speaker, I believe any legislation should not be limited to a specific time or budget, but should provide a clear intention. By adding my amendments, it gives the Minister the ability, it gives a clear intention to support adults with hearing loss and gives the Minister the ability to charge for classes provided for adults with hearing loss. I believe this adds and clarifies rather than detracts from the intention of the bill. My first amendment is listed in Group 1 at Amendment 4. To summarise, this amendment adds the availability of sign language classes taught by accredited teachers or other suitable persons for people aged 25 and over who become deaf, their close families and carers, to learn or improve proficiency in the language. It allows the Department, by negative resolution, to provide for a not-for-profit fee to be payable for these classes. If this amendment is passed, I have listened to what the Minister has said today, and of course at further consideration stage can move that from negative resolution to the affirmative. It's worth noting that the bill in its current format only makes specific provision for sign language classes for young people aged 24 and younger, their families, guardians and carers. And while I agree this is absolutely necessary and it is important to include this in the face of the bill, there are a growing number of adults in Northern Ireland who lose their hearing due to age, illness or trauma. That's 1 in 6 adults across Northern Ireland.
Giving way, and she is right to highlight the fact that there are an increasing number of people that are losing their hearing. However, our research and our consultation indicates that those people are not in the same numbers coming forward looking for those classes. We don't know the demand on that yet. That's why I'm saying let's do a pilot programme to assess, importantly, demand, the delivery partners and what the curriculum could be, because I believe we're walking into something which we may not actually have a demand for because people are looking for other solutions to the problems that she raises. Would that not be an appropriate step to take?
I thank the Minister. I don't agree with you because there are 26,000 people currently sitting on audiology waiting times in the health trusts across Northern Ireland, people who haven't even got their first hearing test done. You say that we don't know how many people need it. There are no classes to test how many people in Northern Ireland would like to have sign language classes. I want to go to them. My partner wants to go to them. The rest of my family wants to go to them. There are none. And unless we have it on the face of this bill, I have to say I don't think that there will be any. These growing number of adults in Northern Ireland who lose their hearing due to age, illness and trauma need to have a specific provision on the face of this bill, just as has been provided for children, to provide classes for this group. My proposed amendment, I have included the ability, of course, for the Department to provide classes for people who have lost their hearing and are becoming deaf That means that while they may well have English, and they can read, and they have communicated the whole way through their life, they can't hear other people speaking English back to them, so they need those people to be speaking sign language to them. I think that's a bit of the part of this sign language bill that's missing. And the Department, of course, may by regulation bring in charges for these classes should the Minister and the Department choose to do so. I used the wording that was proposed by the DUP and brought forward in the Death, Stillbirths and Baby Loss Bill to enable the Department to regulate for fees should the Minister wish to do so. It's not something that is different or unusual for this Assembly and has been accepted before. My second amendment, Amendment 5, is a consequential amendment which would only be put if Amendment 4 is made. My third amendment is Amendment 22. The current definition in the Sign Language Bill limits the deaf community to only those who normally use sign language. It does not take into account those who have lost hearing and those whose communication and subsequent isolation will be improved by using sign language. The reason this needs to be changed is because a person with hearing loss, a person who is deaf, may well have other options to use in order to convey what they want to say. But we need other people to learn sign language to communicate with us. And that's the point. If you normally use sign language but nobody else does, what's the point? Therefore, I wish to make a simple change to update the use of the term who normally use to who will benefit from using sign language. It's more inclusive. But I take Mr Durkin's point and I'm prepared, if there's better language that can be brought forward, to include all the people who will benefit from using sign language, and for others to use sign language, we can certainly do that. The amendment also reflects the ambition for the legislation to promote and increase usage of sign language, something that we all want and is the intention of this bill. On behalf of the Alliance Party, we welcome these amendments and will be voting in favour of all of the amendments in Group 1. We will be voting for all the amendments in Group 2, but I know that's the next part of this debate. And finally, could I thank every single member of the deaf community for their input and patience throughout this programme, this work. I would like to thank the Communities Committee Clerk team. Emer Boyle and the team have worked incredibly hard on this bill. I would also like to thank the Assembly engagement staff who have delivered an innovative and inclusive committee stage, ensuring both BSL and ISL users were included and interpretation provided. I have heard from several deaf people how impressed they have been by the online translations, the ability to attend and give evidence at committee and at outreach sessions, and the option to respond to online services in BSL or ISL, unique in these islands. The Assembly's website videos should be held up as an example of how to effectively engage the deaf community, because those of us who want to use sign language or have no choice but to use sign language are at last included. Mr Speaker, the staff in this Assembly have helped to make this process inclusive. They have all played an important role in helping us to get to this stage. And I'd like to thank, if you could pass on my thanks, Mr Speaker, to the staff of the Assembly, because it has been outstanding work. And finally, I'd like to thank Paula Clark, whose patience and kindness has helped me and others to start to learn and embrace sign language, and that was provided through the Assembly. And to our BSL and ISL interpreters who have been with us throughout this bill, ensuring our investigation into sign language has not left anyone behind. Thank you.
Robbie Butler.
Thank you, Mr Speaker. From the outset, Mr Speaker, the Ulster Unionist Party would like to place on record our thanks to the committee, its staff and all those who have contributed to the work on this bill, and indeed the Minister and the departmental staff, and in particular we recognise the valuable input from stakeholders, and especially the many members of the deaf community who took the time to provide evidence and to share their lived experience, because that's what this legislation should ultimately reflect. Crucially, we also recognise the work of the committee staff team, who ensured that members of the deaf community were able to engage with the committee stage in a meaningful and impactful way, as has been referenced by a number of other members so far. That engagement has clearly helped to shape the bill in a meaningful way, and much of what is before us today reflects that excellent work. going to turn to Group 1, if that's okay, Mr. Speaker, which is sign language classes and definition of the deaf community. And we broadly welcome the intent behind the amendments within this group, because at its core, this is about access to sign language, and getting that right early makes all of the difference. Amendment 1 puts beyond doubt that classes are to be provided free of charge, and that reflects what was always understood, that cost should not be a barrier, particularly for children, young people and their families. Amendment 3, extending the definition of young people to under 25, is also sensible. It reflects that reality that support does not stop at 18, and that transition into adulthood is indeed a key period. Amendment 2, updating the wording to young people who are deaf, may seem minor, but it matters. The language used in the bill will shape how it's delivered in practice. And ultimately, though, the test will be whether it delivers real and meaningful outcomes. Turning to Amendment 22, this proposes to shift the definition from those who normally use British or Irish Sign Language to those who will benefit from using them. And that, again, is a significant change. And while we understand the intention behind it, the wording "will benefit from using" is much broader and less clearly defined. It moves away from those who rely on sign language in their day-to-day lives and opens the scope to a potentially much wider group. And we're certainly listening to that part of the debate today. We're concerned that this would create uncertainty about who the bill is intended to cover and potentially risks diluting its focus. We consider that normally uses a more grounded and workable definition for the purpose of this legislation. Equally, those who lose their hearing later in life could still be captured within the original definition should they come to use sign language in their day-to-day lives. That said, this issue and this amendment is trying to address a very valid point, particularly for those who lose their hearing later in life. That is why we see greater merit in Amendment 4, which seeks to address that gap in a more targeted and practical way. Amendment 4 recognises that there is a cohort of adults who are not currently provided for on the face of the bill itself. Whether through age, illness or trauma, people can find themselves having to relearn how they communicate, often at very difficult points in their lives. There is some provision available, and that is welcome, but access is not always consistent or clear. There is a strong case that this group should not be left without structured support. The amendment provides flexibility, including the potential for fees, but with a safeguard that costs cannot be exceeded. So on balance, we are content to support Amendment 4, but we are clear that the responsibility then rests with the Department to ensure that adequate resources are available so that implementation does not adversely impact on delivery or access, nor does it divert focus from priority groups and does not create any unintended barriers. And as detailed already, Amendment 5 is simply consequential. It follows from Amendment 4 and ensures that the bill remains technically correct, and we are content to support that, Mr. Speaker, and I will address Group 2 in turn. Thank you.
Call on the Minister for Communities to wind.
Thank you very much. Mr. Speaker, can I say that I am absolutely delighted to be in this position for this reason and to be able to introduce and progress this bill. It is something that our deaf community have been waiting on for years and years and years, and I'm delighted that we are now able to progress it further in this chamber today. And I've been humbled to witness firsthand the life-changing difference that early access to family sign language learning is making to families and to their deaf children. The bill requires all prescribed organisations to take all reasonable steps to ensure that services are as accessible to the deaf community as they are to individuals who are not in the deaf community. And that statement seems simple and obvious on paper, but in practice it represents a sea change for those people most closely impacted by the changes that this bill will bring. Can I thank members of the House today for their support for the amendments that I am bringing forward, and can I thank the committee for the way in which they have dealt with these amendments. I just want to take a little bit of time to explain my position in terms of Kelly Armstrong's amendments. And can I say, first of all, that I want to thank her for her interest in this. Can I thank her for the enthusiasm that she has brought to this work as well. And I think that we all have the same outcome in mind. We want to make sure that people have access to the support that they need so that they can effectively communicate. That's where we all want to end up. But I have some concerns with the amendments that she has brought forward. And the first one is in relation to classes. I hope that I have outlined to the House the concerns that I have, not because I don't believe that classes should be in place for those that want to avail of them. I absolutely do. And in fact, there are classes that are there through our colleges as well that people can take part in, and they can pay for those in the same way. And what she is bringing forward is saying that there should be classes and that the department can charge fees for them. However, the evidence that we have received indicates that there is low to no demand for such classes. I accept the Armstrong family may well be an exception to that. I'll happily give way.
Unfortunately, just before COVID, we got interrupted at COVID. I had the fortunate to go along to House Church in Newtonards, where we had up to 30 people learning sign language because they wanted to communicate with other people within the church who use sign language. If you provide it, they will come. At the moment, it's not being provided, so people don't know where these classes are. None of the further education colleges provide sign language classes in my area.
And certainly, I know there is demand for sign language as well, and many people are taking it up. Don't misunderstand me, that's not what I am saying. But I'm referring specifically to people who become deaf later on in life. Often that is not what they want, and she's absolutely right to raise the issues around getting access to appointments through the health service. Correct that she raises that, but the people that we have engaged with, the people that we have spoken to, the organisations are telling us that that is not what they are pushing for. It's not what they believe is their primary objective. Again, I just repeat that the engagement that we have had with deaf sector organisations and health and social care sensory support indicates there is very low demand for that. You'll know who I'm talking about, but I have an official in my department who has worked in this area for 14 years. On 2 occasions, they have evidence of people who have come forward asking for this. One will be covered in what we are already bringing through in the legislation. The other didn't come back with any further requests or information. So I do believe that demand is low. But you're right, we should test that. We should put on a pilot programme and see who becomes available. What we're doing through this amendment is mandating through legislation that there must be classes in place. What does that look like? Who delivers that? What does the curriculum look like? And that is a big issue. The curriculum, we know what the curriculum looks like for children and for younger people and their families, but what does that look like for the age cohort that we're talking about? Those are all questions that need to be answered, and I do think that it is prudent to find that out first, and that we don't need to put it in legislation in order for us to proceed with that pilot programme. So that's what I'm putting to the House today. I understand from the comments that are made that that probably is not reflective of where the rest of this chamber is, but I do think that that's the prudent move to take. Let's find out what that demand is. Of course, we don't need to put it in legislation at all to provide any of these classes. However, that's what we are doing. But I think when you're exploring the curriculum needs and others, I think it would be prudent for us to explore that in the first instance, and that's what I would put to the House, reminding members that there is obviously going to be that 5-year review, and I'm more than happy to make sure that amendments could be put in further on if that is required. What we are being told is that it is not where the demand is for those that lose hearing later on in life. But let's do the pilot programme to find that out. And if there isn't that demand that is there, we shouldn't be bound by legislation to provide something that isn't required. So that's my view on that, and I am more than willing to work with members of this House to work through those issues over the course of the next year. But I recognise there may be other views, but I hope that people would take that on board. Of course, if her amendment, if the first amendment is passed, we will be accepting the second one because of the consequential nature of that, and it would make sense. But in regards to her last amendment, again, I have concerns in relation to this because of how it will change the bill and what we're trying to do. This bill is focused on those across society who rely on British Sign Language and Irish Sign Language, and deaf-blind people who rely on hands or tactile signing versions of BSL and ISL. I think that the third amendment from the member actually risks diluting the focus of this bill, and I agree with the member for Lagan Valley on that one. I think it does change it. The focus for our bill was on that small group of people and their families who have to have up until this point been effectively excluded from access to information and services that the rest of our society take for granted. And the aim of the bill is to recognise the deaf community of people who rely, who depend on sign language and who wish to share their deaf culture and access services through those languages. And I don't think it's intentional, but I think that the member's amendment actually dilutes that and takes that focus away from those who do rely exclusively or who normally use British Sign Language or Irish Sign Language, and I'll give way to the member.
Minister is saying, but it's just to highlight again, if the deaf community by themselves, those who are already users of sign language, are the only people who are being looked at within this bill, then we're missing the fact that we can't get communication from others out there, and we need more than just the deaf people. We need the wider community to be able to speak with us.
Yeah, and of course that's what we want. Whether or not somebody else is able to communicate with you, if you're a user of that sign language, you're actually already covered, and then the amendment becomes, what we have here at the minute is deaf or deaf-blind people who normally use British Sign Language or Irish Sign Language for communication. I think the point that the member is trying to make is that there might be others that are not capable of using that language. I'm happy to take another intervention because I'm not quite clear on what she's saying.
It's to make it very clear. If we are promoting, as it says under Chapter 1 of the bill, as introduced, if we are promoting sign language, it's not to hold sign language to only people who currently require sign language because they're deaf. Those people need to communicate with others, and others need to communicate with them. It's opening up, rather than saying, if you use sign language, this applies to you. If you use sign language and want to speak to someone else, those other people can't access supports. So if we want to talk to a GP, then the GP needs to be able to use sign language. So let's open it up and promote sign language wider.
I'm more than happy to promote sign language widely, but the Chapter 4 states what is the definition of the deaf community for the purposes of this part and for the purpose of the sign language bill. The deaf community comprises all people falling within one or more of the following paragraphs, and that includes deaf or deaf-blind people who normally use British Sign Language or Irish Sign Language for communication. That is the group of people that we are trying to help. That primarily this legislation is being put in place to help them first and foremost. It is those that depend upon it, rely on it, not just those, because I think it does, as the member, Mr Butler, has indicated, it widens it out to a wider group of people, not just those that will sometimes use it or may at some stage benefit from using it, but those who rely on it, those for whom they cannot get by, they cannot get through the day, they cannot access public services without it. That is my focus within this bill, and helping those people who have not had the rights that the rest of us enjoy, that the rest of us can so often take for granted. So I want to make sure that that's who the focus is on whenever the consultation takes place, that those first and foremost are the people that we are focusing on. Yes, there are a wider cohort of people who may use it in their everyday lives, those who perhaps are hard of hearing as well. But the focus for me within this bill is that group of people first and foremost that have struggled so much and haven't had the rights. So that is why I will be opposing her amendment, because I'm determined that this bill will ensure that the deaf community of BSL, ISL and deaf-blind signers will not only benefit from increased accessibility to public services, but through the increased visibility, awareness and understanding of languages and deaf culture, wider society will embrace the deaf community, and the daily communication barriers experienced by the deaf community will be removed. Therefore, I beg to move.
Amendment proposed to clause 2, page 2, line 13, after classes, Amendment 1. After classes insert free of charge. The question is that Amendment 1 be made. All those in favour say aye. Aye. Contrary, if any, no. Moving to Amendment 2. Amendment 2 has already been debated. As a paving amendment for Amendment 3, I call the Minister for Communities to formally move Amendment 2.
I beg to move.
Amendment proposed to clause 2, page 2, line 15, leave out deaf children and insert young people who are deaf. The question is that Amendment 2 be made. All those in favour say aye. Aye. Contrary, if any, no. The ayes have it. The ayes have it. Amendment 3 has already been debated, and I call the Minister for Communities to move formally Amendment 3.
Beg to move.
Amendment proposed to clause 2, page 2, line 17, leave out and insert words as printed on the Marshall list. The question is that Amendment 3 be made. All those in favour say aye. Aye. Contrary, if any, no. The ayes have it. The ayes have it. Amendment 4 has already been debated. I call Kelly Armstrong to formally move Amendment 4.
Moved.
Amendment proposed to clause 2, page 2, line 17, insert words as printed on the Marshall list. The question is that the Amendment 4 be made. All those in favour say aye. Aye. Contrary, if any, no. Clear the lobbies. The question will be put in 3 minutes. Order. Members resume their seats. The question is that the Amendment 4 be agreed. All those in favour say aye. Aye. Contrary, if any, no. No. Do we have tellers? Order. Tellers have been appointed as follows. Tellers for the ayes are Donny Donnelly and Andrew McMurray. Teller for the noes are Pam Cameron and Brian Kingston. Clear the lobbies. The House will divide. Ayes to my right and noes to my left.
stakeholder group.
Secure the doors. Order. Members will resume their seats. Clerk, read the result.
69 members voted, 47 members voted aye, 22 members voted no. The amendment is made.
It was made. The question is that Clause 2 is amended to stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. No amendments have been tabled to Clause 3. The question is that Clause 3 stand part of the bill. All those in favour say aye. Contrary, if any, no. I think the ayes have it. The ayes have it. Amendment 5 has already been debated and is consequential to Amendment 4. I call Kelly Armstrong to move formally Amendment 5.
Moved.
The question is that if Amendment 5 be made, all those in favour say aye. Aye. Contrary, if any, no. The ayes have it. The ayes have it. We now move to the consultation, conferral of functions, reporting and assembly control. And this is the second group of amendments for debate. With Amendment 6, it will be convenient to debate Amendments 7 to 21. I call the Minister for Communities to move Amendment 6 and to address the other amendments in the group.
Is there a point of order? Mr. Speaker, is Amendment 22 being taken? Not at this stage. Okay. That's fine.
Is it in the first group?
Well, okay.
Point of order, Mr. Speaker. Is Amendment 22 in the first group?
Just to be clear, Amendment 22 has already been debated. It will be voted on in the second batch. So we now call on the Minister to move his Amendment 6 and then debate the Amendment 7 to 21. Order, members, if you'd leave quietly, we have business to do here.
Mr. Speaker, with the exception of Amendment 18, the amendments that I propose within this group have been developed with the agreement of the committee. They are largely technical and clarifactory in nature, and I believe will improve the delivery of the bill. In regards to Amendment 6, Clause 4 provides the Department with the statutory powers to list in regulation those public bodies which will be required to take the reasonable steps outlined in Clause 3. The amendment is technical in nature and clarifies how the Department must, by regulations, list public bodies as prescribed organisations for the purposes of the bill. The committee has requested that rather than listing public bodies as prescribed organisations by negative resolution, the Department should use affirmative resolution. My officials were of the view that this is an administrative duty and that negative resolution would provide a proportionate level of scrutiny for such an administrative exercise. It would also expedite the listing of public bodies to ensure they would be subject to the duties of this bill sooner. The committee suggested the compromise of adding a public body as a newly prescribed organisation by negative resolution, whereas the removal of a public body as a prescribed organisation should be by affirmative resolution. The OLC advised that it is technically very difficult to separate the two things in one clause, using negative resolution procedure for one and affirmative resolution procedure for the other. I am therefore content with this amendment to clarify that regulations with regard to the listing of public bodies may not be made unless a draft of them has been laid before and approved by a resolution of the Assembly. The amendments to Clause 5 are technical and clarify how my department engages and consults. Clause 5 places a duty on my department to issue guidance about the statutory duties in the bill. Before issuing that guidance, my department must consult each of the public bodies listed as prescribed organisations and which are subject to the duties in the bill. Prior to this amendment, the bill placed a duty on my department to consult with at least one person or group acting on behalf of the deaf community. This was a drafting device intended to emphasise the need for consultation. At the committee's request, I now propose to increase the number of people or groups whom the department must consult from at least one to at least two. Amendment 8 clarifies that each of the persons or groups who is consulted is representative or cognisant of the views or interests of the deaf community. The amendments to Clause 7 are technical in nature. Amendment 10 is a technical clarification, as is Amendment 11, 12 and 13. The amendment to Clause 7.5b again is similar to that of Clause 5.3b, and for the avoidance of doubt removes perceived reliance on a single source for consultation, strengthens the scope of consultations and is consistent with the committee's request to amend. Amendment 15 is a technical clarification. Amendment 16, the amendment to Clause 8 are technical in nature and clarify how the department must engage with the deaf community when fulfilling consultation duties, ensuring engagement will be inclusive, representative and balanced across both BSL, ISL and deaf-blind people. Amendment 17 is a technical clarification. In Amendment 18, the new Clause 8a is also a technical amendment, and this brings further clarity on how the department must consult with the deaf community, including references to part of the deaf community. I have in advance shared a draft of this new clause with the committee, as it emanates from the committee's request for clarity with regards to how engagement and consultation must involve representatives from both BSL and ISL. This amendment therefore ensures balanced input on BSL, ISL and deaf-blind methods of signing. Officials are exploring options to increase the numbers of interpreters for deaf-blind people, which is an entirely different issue to the capacity building of BSL and ISL interpreters. Therefore, when we need to consult on deaf-blind issues, we would not necessarily need to consult with the whole deaf community, as it may not be relevant to everyone. It is a deaf-blind issue. When consulting, the department must actively seek input specific to BSL, input specific to ISL and general input relevant to both languages. This prevents any consultation from becoming one-sided or unintentionally favouring one language group. Clause 8a strengthens the fairness, breadth and quality of consultation and ensures that voices from across the deaf community are heard and reflected in departmental decision-making. It provides clarity and flexibility for officials, reducing the risk of challenge over who was or wasn't consulted. Amendment 19 is an amendment to Clause 9, which reflects the request from the Committee that a report evaluating the impact of the legislation should be laid before the Assembly by the Department. In Amendment 20, that amendment to Clause 9 reflects the request from the Committee that a report evaluating the impact of the legislation should be laid not more than 5 years after the legislation coming into operation, and thereafter every 3 years. Clause 10 requires the Department to make regulations to establish a scheme for accrediting teachers and interpreters of BSL and ISL. This will provide assurances with regards to professional competence and safeguarding. There is no intention by the Department to collect fees for such schemes at this time. However, I have agreed to the Committee's request to amend Clause 10.5 as there is provision for the schemes to be with or without fees payable. The reference to the potential collection of fees is sufficient to merit tabling this amendment. The amendment is straightforward in providing that rather than being subject to negative regulations may not be made unless a draft of them has been laid before and approved by a resolution of the Assembly. Therefore, I beg to move.
I call the Chairman of the Committee for Communities, Mr. Colm Gillingham.
I rise to speak to the amendments in Group 2, consultation, conferral of function, reporting and assembly control. In relation to Amendment 6, this amendment was a committee request to ensure that when the Department removes organisations from the prescribed list, which must take reasonable steps to provide information and services and offer or facilitate the use of ISL and BSL, that this was done through affirmative procedure to ensure maximum transparency. Committee were content that adding and editing, for example, to organisations changing names, could be by negative resolution, but the Minister changed both to affirmative, which is welcomed by the Committee. The evidence we received stressed that the list's impact depends on a broad, inclusive and clearly defined list of prescribed organisations, developed and regularly reviewed with mandatory deaf community consultation rather than solely by the Department for Communities. Many warned that a narrow or discretionary approach, vague definitions of public body and limited Assembly scrutiny could allow key organisations delivering public functions across health, education, justice, social care, housing and community services to be excluded, undermining equality of access. Respondents therefore called for clear inclusion criteria, regular reviews, accessible publication of the list, extension over time to non-statutory bodies providing essential public services, and consideration of centralising interpreting or VRI models to support consistent BSL, ISL access, particularly for vulnerable groups such as deaf children, older deaf people and survivors of abuse. Questions were also raised about what was meant by the term public character. The Committee advised the Department to make clear what persons or groups exercising functions of a public character means in practical terms to mitigate any misunderstanding that this may mean services outside the public sector. Amendment 7 was requested by the Committee on the basis that there was consensus that consultation on the guidance must be meaningful, inclusive and ongoing, with concern that the requirement to consult at least one person or group acting on behalf of the deaf community was too narrow and risks excluding the diversity of the deaf community, including BSL and ISL users, deaf-blind children, young people and families. Many called for broader, structured consultation involving multiple deaf-led organisations and sectors, the establishment of a national advisory group or formalisation of the Sign Language Partnership Group. The Committee also advised the Department to make what is meant by the deaf community here more explicit, to ensure that at least two persons or groups are not two from the same part of the community. It is my understanding that the Minister has moved on this at Amendment 18, which is again welcome. Amendment 8, made by the Minister and Committee, took the view that this again strengthened the consultation element and agreed Clause 5 as amended by the Minister in this regard. Clause 7 related, Amendment 9, Clause 7 related to the Department's regulation making powers, which we were advised it didn't intend to use at this time and were instead using guidance for prescribed bodies to ensure they carried out their duties. The Committee was clear in its report that the Department should make full and appropriate use of its regulation making powers under Clause 7 as soon as it becomes apparent that guidance alone is not enough. This would ensure that deaf and deaf-blind people do not need to identify as disabled to access linguistic and cultural rights. Where Clause 7 exempts any public bodies from the duties of this bill, this should be communicated clearly and in a timely manner to the committee. The committee was content with Amendment 9, which would make sure that where the department needed to make regulations, for example in relation to education, that it was appropriate that the same regulations wouldn't apply to health. This provides for functions that can be conferred on all departments or specific individual departments subject to the matter at hand. Amendments 10 and 14 came after committee stage, and so committee did not take a view on these. However, committee did consider amendments proposed by the Minister at 11, 12, 13 and 15 and considered these technical in nature and indeed again strengthen the consultation element of these regulation making powers where guidance does not suffice, and we welcome that. Like Amendment 7, committee requested Amendment 16 on the basis that respondents broadly welcome the inclusion of a statutory consultation requirement before regulations are made, recognising the role of the Sign Language Partnership Group in previous engagement, but expressed dissatisfaction with the wording required, which stated that at least one person or group acting on behalf. This was viewed by committee as tokenistic potentially and unrepresentative and lacking transparency. Many who we heard from warned that consulting a single individual or group cannot reflect the full cultural, linguistic and experiential diversity of the deaf community, including BSL and ISL users, deaf-blind people, young people, families and regional communities, and risked undermining the bill's purpose. Respondents therefore called for Clause 8 to be strengthened to require consultation with a broad and representative range of deaf-led organisations. Committee noted in relation to concerns regarding lack of assembly scrutiny in Clause 7's regulation-making powers. Clause 8 provides that any regulations in Clause 7 is subject to the draft affirmative assembly procedure, which affords this assembly a higher level of scrutiny over these regulations. Again, like Amendment 7, committee advised the department to make what is meant by the deaf community here more explicit, to ensure that at least two persons or groups are not two from the same part of the community. It is my understanding that the Minister has moved on this at Amendment 18, which again is welcomed. Amendment 18, as mentioned before in terms of consultation at Amendment 7 and 16, came after committee stage, and so committee did not consider it. This is a new clause, and we are advised by the Department that it's technical in nature, intending to bring further clarity on how the Department must consult with the deaf community, including references to part of the deaf community. They gave the example that if they need to consult on deaf-blind issues, they would not necessarily need to consult with the whole deaf community, as those issues may not be relevant to everyone. It also clarifies the Department is in particular to seek to secure input relating specifically to each of, as well as input relating generally to both of, British Sign Language and Irish Sign Language, which is an issue that was raised with committee during the scrutiny of the bill, and indeed we recommended that this be clarified in the EFM. The Department believes this additional text delivers on that, but with explicit statutory weight. Amendments 19 and 20 were requested by the committee and relate to how and when the Department reports on the impact of the legislation. Respondents broadly supported the statutory requirement for the Department for Communities to publish a report evaluating the bill's impact, viewing this as a key mechanism for accountability, reflection and identifying ongoing barriers, but raised concerns about the lack of scrutiny, detail and engagement in Clause 9 as drafted. Committee requested on that basis that the reports are laid before the Assembly at Amendment 19. Respondents highlighted that reports lack mandated consultation with the deaf community and risk becoming tokenistic unless they're accessible in BSL, ISL and English and underpinned by clear outcome-focused metrics. There was consensus that the clause should specify reporting content, performance indicators and monitoring arrangements, including measures on interpreter availability, service accessibility, deaf-blind experiences, education, employment and quality of life measures. Most respondents felt that a 5-year interval was too long, and through the evidence committee heard, it requested after the first 5-year report to allow time for the legislation to embed, as we heard from officials, that every subsequent report then would be at 3 yearly intervals, and therefore we welcome the Minister making Amendment 20. It was noted that if the clause was not commenced at royal assent or shortly thereafter, the first report would take longer than 5 years to be published, and we eagerly await the commencement of this clause very close to royal assent for this reason. Finally, Amendment 21 relates to the assembly procedure for the accreditation scheme for teachers and interpreters, and committee requested this was changed from negative to affirmative procedure based on the evidence we received during committee stage and the level of concerns raised around this issue. Committee recognised there is ongoing work with the Department and National Registers of Communication professionals working with deaf and deaf-blind people and the Register of Irish Sign Language Interpreters, but that there is currently no equivalent body for BSL ISL teachers or tutors. Accreditation is essential for quality, consistency and public confidence, and must be reflective of the North's use of both BSL and ISL with equal recognition for each. We also heard that hearing-led models risk excluding experienced deaf tutors and undermining linguistic and cultural norms. There was broad agreement that teachers and interpreters require distinct accreditation schemes with clear, accessible pathways, recognition of existing qualifications across the North, Britain and Ireland, and supportive transition arrangements for experienced tutors without formal accreditation. Respondents highlighted acute workforce shortages, particularly in ISL, deaf and deaf-blind interpreters, calling for long-term investment in education, early years provision, training routes, bursaries and career pipelines, while maintaining quality over volume. Concerns were raised about the absence of timescales and clarity on deaf-blind interpreting. There was a clear consensus that accreditation must be developed with, by and for the deaf community to raise standards while building sustainable capacity. So in conclusion, in terms of my chair remarks, Ceann Comhairle, this is a historic and a long overdue moment for the deaf community in the North. It's about fairness, inclusion and recognition. The Committee for Communities stands fully behind the bill and supports its progression through the further and final stages in this place. It is also worth noting the remarkable consultation process and committee stage process that was facilitated by committee clerks and her team that allowed proper and genuine co-production, and I think that has shown itself in what is a very well co-designed and co-produced bill. And I just say finally as Chair to all of you who have fought tirelessly for this day to come, thank you. Thank you. Your advocacy, resilience and vision have made this possible. Ceann Comhairle, now just make a few brief remarks as Sinn Féin spokesperson for communities. On behalf of Sinn Féin, I want to state how proud my party colleagues and I are to stand here today and support the Sign Language Bill at consideration stage. This bill will go a long way towards ensuring that the deaf and deafblind community can play a full and equal role here in our society. For too long, their right to access public services in their own language has been denied. Whilst I accept that many challenges remain in delivering full equality for this community, this Sign Language Bill is an important step in the right direction. Ceann Comhairle addressed much of the detail in my Chair's remarks, so I won't repeat those now, but I do want to reiterate my thanks to the community for their input into the committee stage. This is their bill, and so it was entirely appropriate that we took the time at committee stage to hear as many views as possible and to shape this legislation according to their needs. It has been, Ceann Comhairle, an honour for me personally to meet so many people from the deaf and deafblind community over the past year and to learn just how important their language is to them, both as a tool of communication and this is, I think, crucial, an intrinsic part of their identity and culture, and indeed a vibrant, a beautiful and a dynamic part of that culture. I have enjoyed very much the time I have spent learning sign language, and this is something which I intend to continue long into the future. I was very eager to ensure that the co-design process didn't end with the introduction of the bill and that it was continued right through the legislative process. And I firmly believe that we have done that in an effective way. And our example of best practice can and should be replicated in other scrutiny committees going forward. Ceann Comhairle, co-design works, and this bill is an example of what can be achieved when co-design is done in the correct way. Ceann Comhairle, and
Mark Durkin.
Thank you very much, Mr. Speaker. The Minister and the Chair have outlined succinctly and comprehensively the rationale, purpose and function of each individual amendment here before us in Group 2. They all do tie in together to improve and strengthen the legislation. The majority of them, as has been outlined, are really the fruits of a thorough, a robust and a constructive committee stage. Again, the Chair has described in detail the deliberations of the committee that were the genesis of many of these amendments, and I'll spare members and those watching the repetition of all of that. As earlier indicated, the SDLP support this important but overdue bill and welcome and support all of these amendments. We look forward to the bill's progression through the Assembly process and its ultimate impact on the ground, opening doors, affording opportunities and enshrining equality.
Thank you, Mr Speaker, and I rise to support the sign language bill at consideration stage. And at this point I just wanted to put on record my thanks to both the Minister and indeed the Chair of the Committee for outlining so well the work of this piece of legislation as it has made its way through committee. It is important to note that it was a complex, sensitive piece of legislation, and that this Assembly, I think, has done itself proud in ensuring that those who were most important within this conversation were very much heard, and that we were able to hear them. That's the deaf community, and the work that's gone in by this House to facilitate that, I think, has been phenomenal and is a great example, I think, for going forward. So this is clearly a very important piece of timely legislation, and we are so glad to see it today making its way through this chamber. It's about recognition, it's about respect, and most importantly it's about improving the everyday lives of people across our communities who rely on both British and Irish Sign Language. For many in the deaf community, barriers still exist in accessing services, information and opportunities that others can often take for granted. This bill represents a clear and meaningful step towards addressing those barriers. It places a duty on government not simply to acknowledge sign language, but to actively promote it and to consider the needs of those who use it. And that matters, Mr Speaker. I want to place on record my appreciation to the Minister for Communities. The Minister has approached this legislation in a thoughtful, measured and a constructive way, and it's clear that there has been genuine engagement with stakeholders and a willingness to listen throughout the process. I also want to acknowledge and thank the departmental officials for their work in bringing this legislation forward and supporting its progression through the Assembly. I know that has gone on over many years, and that is greatly appreciated. The Minister's amendments brought forward reflect that approach, and they strengthen the bill. They provide clarity and they ensure the legislation is workable and deliverable in practice. Crucially, they do so without losing sight of the original purpose of the bill, and that is a right balance to strike. This is not legislation for the sake of legislation. It is focused, it is proportionate, and it is grounded in what will make a real difference. I also think it's important to recognise that this bill does not exist in isolation. It sits within a wider context of how we support people, how we remove barriers, and how we ensure that services are accessible to all. What this bill does provide is a strong foundation on which we can continue to work. It recognises sign language as an integral part of our society. It places a responsibility on departments to reflect that in how they operate. Mr Speaker, there will always be calls, of course, to go further, and that is the nature of any legislation, but it's important that we proceed in a way that is evidence-based, that is sustainable, that ensures delivery. The Minister has made it clear that where further work is needed, it will be taken forward in a practical and measured way. That is the responsible approach, particularly in the current financial climate. But what we have before us today is a bill which is clear in its intent and realistic in its delivery. It is a bill that has been carefully developed, properly scrutinised and broadly supported. Above all, it's a bill that sends a clear message to the deaf community that their language, their culture and their voice are recognised and valued. For those reasons, I am pleased to support the bill at this stage, and I look forward to seeing it progress further. Thank you, Mr Speaker.
Robbie Butler.
Thank you, Mr. Speaker. I rise to speak on Group 2, which is the consultation functions, reporting and indeed assembly control. And these amendments that are captured within Group 2 are really about how the bill will operate in practice, how decisions are made and how people are engaged, and crucially how the Assembly holds that process to account. Amendments 6, 7 and 8 we believe will strengthen consultation requirements, and that has to be welcomed. Engagement, though, must be meaningful, ongoing and not just a tick box exercise. Amendments 13 through to 16, which move from consultation with one person or group to two or more, are sensible. They reduce the risk of engagement being too narrow or dominated by a single perspective. That said, numbers alone are not enough. What matters is that the engagement reflects the diversity of experience within the deaf community. Amendment 17, Mr. Speaker, provides further clarity around those who are representative or cognizant of those views. That flexibility we believe to be helpful, but it will need to be applied carefully to ensure that it works as intended and indeed in practical practice. Amendment 18 is a significant addition. It places a clear requirement on how engagement is carried out, and in particular recognises the need to reflect both British and Irish Sign Language. That reflects the reality here and strengthens the bill, we believe. Amendments 19, 20 and 21 continue that theme, reinforcing the need for consultation to reflect different parts of the deaf community. And the principle, Mr. Speaker, is sound. The key will be consistent and meaningful delivery, which we will be mindful to keep an eye on. Amendments 9 to 12 strengthen Assembly oversight by moving key powers to the affirmative procedure. That is a positive step and one to be welcome, and ensures that regulations are properly scrutinised and approved. The changes to Clause 9, requiring reports to be led before the Assembly and reducing the reporting period from 5 years to 3, are also welcome and should help us to refine, review and improve. They have the potential to improve transparency and help maintain momentum and hopefully garner the confidence of the deaf community. Similarly, the amendment to Clause 10, applying the affirmative procedure, is an important safeguard. Overall, Mr. Speaker, these amendments, we believe, strengthen the bill, particularly in relation to consultation, accountability and oversight. They place a greater emphasis on meaningful engagement, ensure a broader range of voices are heard, and enhance the role of the Assembly in scrutinising how the bill is implemented. Ultimately, however, Mr. Speaker, the test will be delivery, ensuring that what is set out in the bill translates into real, practical support for those who need it, and that the commitments made here are followed through in practice. And just add on the final note that this bill is a really good piece of legislation, having looked through it and obviously communicated with my committee, my party colleague who is on the Communities Committee, Andy Allen, who has applied rigorous scrutiny to this and has indeed been all over the detail. But the reflection of this must be felt by our deaf community, regardless of their age or where they are in our community at the moment.
I call the Minister for Communities to wind.
Thank you very much, Mr. Speaker, and can I thank everybody who contributed to today's debate. This is a bill that has been developed in consultation and in partnership with the DEDA community and strengthened, I believe, through constructive engagement with the committee. Now, I think it's fair to say, Mr. Speaker, that I have had some issues with how the committee does its job, and I am sure the committee has some issues with how I do my job as well. However, that being said, I think this is a good example of committees working well, listening to concerns, taking on board changes and genuine working together. I have to say I have been impressed with the way in which the committee has ensured that this has been accessible to those who are going to be affected most by it. So I do want to thank the committee, and in particular the committee staff, who I'm sure had much work to do in terms of the organisation and setup to make sure that that was able to happen. I'm going to continue to work with the deaf community and those who have a role in promoting sign language, which has already increased visibility, access and opportunities for people to learn and use it in everyday life. I believe that this has been good work that we have been involved in. It's not the end, and I will have more to say at later stages of this bill, but for now I thank everybody that has helped us to get to this stage and look forward to it passing consideration stage in the Assembly. Thank you, Mr. Speaker.
Ms Armstrong, I apologise a minute to call you, but if you wish to speak, you're welcome to do so.
Thank you very much. As I said earlier, Group 2 amendments, all in the name of the Minister, of course, will be accepted by the Alliance Party today, and we're delighted to do so. The Minister and his officials were able to engage with the Committee for Communities in a way that had open ears, willing to listen and willing to take forward amendments that have made this bill significantly improved. Sometimes when you have officials that come to see committees, they do so with hesitation and with some concern that we're just there to get in the way and be awkward. But to be honest, we all believe in the same thing, that we have to make better provision for people who are deaf, who use BSL, ISL and deaf-blind language. It is an absolute delight today to see that in Group 2 that the Minister and the Department have increased the number of organisations and people who will be consulted with. Given this bill covers a number of languages, not just one language, but BSL, ISL and eventually then deaf-blind, it means then that the consideration has taken into place, and the committee was concerned that if it was just one person listed, in the future it could have been a representative of BSL or a representative of ISL, but that has been changed now by the Amendment 18, which is the new clause that's being added in before Clause 9. The Minister, I think, and the Department had also committed to add to the explanatory and financial memorandum the intentions that when consultation takes place that representatives of BSL and ISL would be considered. So it talks in the bill about 2 groups or individuals. That may actually be 1 from each language, if that's appropriate, because as the Minister rightly said, there will be parts of regulations going forward that may relate only to deaf-blind, for instance, or could be to ISL or BSL, so that makes perfect sense. By changing the requirement to lay regulations from negative to resolution to require approval of the Assembly also helps to improve transparency, and that's something that we're all very keen to do, and we know it's one of the recommendations that came out of the RHI report, that transparency should be improved in this place. I welcome Amendment 20, Clause 9, 5 years for the first report and 3 years thereafter. When you count up the timelines on this, what that means is that there will be 5 years, plenty of time for the Department and people within the deaf community to work together to bring forward some of the regulations that are currently outstanding. And it also means then that every 3 years means that reports will be laid within different mandates rather than perhaps some falling within the one mandate. The Amendment 21, while it talks about the subject to negative resolution being changed to approved by resolution of the Assembly, is just to draw attention to Clause 10. Clause 10 is very important because it talks about teachers and interpreters and the accreditation of both. It's vitally important that we don't throw the baby out with the bathwater on this one. People who have used sign language from birth or later in life, who are fantastic at doing that and have a shared lived life experience that they can express through language, is vital when you talk to the culture and promotion of sign language. And I know today we have Brian Symington, John Carberry, and I think about John Carberry's wife Agnes, who have all through their use of sign language been able to support and help children, particularly those in the Jordanstown School for the Deaf and Blind, to use sign language in a way that I can't at the moment because mine is very static and stilted, but theirs is a free-flowing, beautiful language that is able to be shared with children so that they too can use their signs in very expressive ways. It's beautiful to see, and it's beautiful to see the smiles in those children's faces when others communicate back with them. I would just like to say that this is an important bill, as others have said, and on behalf of the Alliance Party, I do thank the Minister and his department for bringing this forward. I hope we can get this all done and dusted before summer recess, or even before that if we could, but it's vital that we show the deaf community that when we commit to doing something and to moving forward legislation, that we do it. And I thank the Minister and the Department for doing that, and also to my colleagues in the Communities Committee. This was one of our first big pieces of this mandate, and I know we took a little bit of extra time in order to get the consultation right. I think it was done very well. It was very inclusive. We have heard from others that this was better than other parts of these islands who have put through sign language bills. What I would ask, just as my final point, is to the Minister and to the Department, if they would consider using the learning that has come from the Assembly and how the Assembly has allowed consultation to happen, where people can provide their consultation responses by video in sign language, because it is so valuable and it means then that people are able to communicate in their language. Thank you very much, Mr. Speaker.
Thank you, Minister. If you have anything further to add, or we'll leave the last word with Mrs. Armstrong. There you are, you got the last word, Ms. Armstrong. Not for. Okay. Amendment proposed to clause 4, page 3, amendment 6 rather. Proposed to clause 4, page 3, line 7, leave out and insert words as printed on the Marshall list. The question is, amendment 6 be made. All those in favour say aye. Wonder if any no. The ayes have it. The ayes have it. The question is that clause 4 as amendment stand part of the bill. All those in favour say aye. Wonder if any no. The ayes have it. The ayes have it. Amendment 7 has already been debated. I call Minister for Communities to formally move Amendment 7.
Beg to move.
Amendment proposed to clause 5, page 3, line 27, leave out one person or group and insert two persons or groups. The question is that Amendment 7 be made. All those in favour say aye. Wonder if any no. The ayes have it. The ayes have it. Amendment 8 has already been debated. I call the Minister for Communities to formally move Amendment 8.
Moved.
Amendment proposed to clause 5, page 3, line 27, leave out and insert words as printed on the Marshall list. The question is that Amendment 8 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. The question is that clause 5 as amendment stand part of the bill. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. No amendments have been tabled to clause 6. The question is that clause 6 stand part of the bill. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 9 has already been debated. I call the Minister for Communities to formally move Amendment 9.
Moved.
Amendment proposed to clause 7, page 5, line 1, leave out and insert words as printed on the Marshall list. The question is that Amendment 9 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 10 has already been debated. I call the Minister for Communities to formally move Amendment 10.
Moved.
Amendment proposed to clause 7, page 5, line 3, before persons insert any. The question is that Amendment 10 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 11 has already been debated, and I call the Minister for Communities to formally move Amendment 11.
Moved.
Amendment proposed to clause 7, page 5, line 4, after insert after acting on behalf of. Sorry, I'll just read that again. After acting, insert on behalf of. The question is that Amendment 11 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 12 has already been debated. Call the Minister for Communities to move formally move Amendment 12.
Moved.
Amendment proposed to clause 7, page 5, line 5, after functions, insert on behalf or. The question is that Amendment 12 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 13 has already been debated, and I call the Minister for Communities to move formally Amendment 13.
Moved.
Amendment proposed to clause 7, page 5, line 15, after relevant, insert material or. The question is that Amendment 13 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 14 is already debated. I call the Minister for Communities to move formally Amendment 14.
Moved.
Amendment proposed to clause 7, page 5, line 18, leave out person or group and insert persons or groups. The question is that Amendment 14 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 15 has already been debated, and I call the Minister for Communities to move formally Amendment 15.
Moved.
Amendment proposed to clause 7, page 5, line 18, after behalf, insert or in the interests. The question is that Amendment 15 be made. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. The question is that clause 7 as amended stand part of the bill. All those in favour say aye. Contrary if any no. The ayes have it. The ayes have it. Amendment 16 has already been debated, and I call the Minister for Communities to formally move Amendment 16.
Moved.
Amendment proposed to clause 8, page 5, line 27, leave out one person or group and insert two persons or groups. The question is that Amendment 16 be made. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 17 has already been debated, and I call the Minister for Communities to formally move Amendment 17.
Moved.
Amendment proposed to Clause 8, page 5, line 27, leave out and insert words as printed on the martial list. The question is that Amendment 17 be made. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. The question is that Clause 8, as amended, stand part of the bill. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 18 has already been debated, and I call the Minister for Communities to formally move Amendment 18.
I beg to move.
The amendment proposed before Clause 9 insert new Clause 8a, Department's manner of engagement. The question is that Amendment 18 be made and the new clause be added to the bill. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 19 has already been debated, and I call the Minister to formally move Amendment 19.
Moved.
Amendment proposed to Clause 9, page 5, line 38, insert words as printed on the martial list. The question is that Amendment 19 be made. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 20 has already been debated, and I call the Minister for Communities to formally move Amendment 20.
Moved.
Amendment proposed to Clause 9, page 6, line 4, leave out 5 and insert 3. The question is that Amendment 20 be made. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. The question is that Clause 9 as amended stand part of the bill. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 21 has already been debated, and I call the Minister for Communities to formally move Amendment 21.
I beg to move.
Amendment proposed to Clause 10, page 6, line 25, leave out and insert words as printed on the martial list. The question is that Amendment 21 be made. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. The question is that Clause 10 as amended stand part of the bill. All those in favour say aye. Contrary if any, no. The ayes have it. The ayes have it. Amendment 22 has already been debated, and I call Kelly Armstrong to move formally Amendment 22.
Moved.
Amendment proposed to Clause 11, page 6, line 33, leave out who normally use and insert who will benefit from using. The question is that Amendment 22 be made. All those in favour say aye. Aye. Contrary if any, no. Clear the lobbies. The question put in 3 minutes. Order. Members resume their seats. The question is that Amendment 22 be agreed. All those in favour say aye. Contrary, if any, no. Do we have tellers? Order. Tellers have been appointed as follows. Tellers for the ayes are Donny Donnelly and Andrew McMurray. Tellers for the noes are Brian Kingston and Pam Cameron. Clear the lobbies. The Assembly will divide. Ayes to my right, noes to my left. Order. Members resume their seats. Clerk, read the result.
67 members voted, 39 members voted aye, 28 members voted no. The amendment is made.
The amendment was made. The amendment was made. The question is at clause 11. As amended, stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. No amendments have been tabled to clause 12. The question is at clause 12. Stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. Clause 13. No amendments has been tabled to clause 13. The question is at clause 13. Stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. No amendments have been tabled to clause 14. The question is that clause 14 stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. No amendments have been tabled to clause 15. The question is that clause 15 stand part of the bill. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. The question is that the long title be agreed. All those in favour say aye. Contrary, if any, no. The ayes have it. The ayes have it. That concludes the consideration stage of the Sign Language Bill. The bill stands referred to the Speaker. Can I offer my personal congratulations to the Assembly, the Committee and all the members involved in bringing forward this particular piece of legislation. I think it's really important that we've done that, so well done to everyone. If you take your ease to move to the Hospital Car Parking Charges Bill.